Teen Foundation has been doing considerable work. It's about 10 years old now. And we have been organizing a lot of health writers workshop, and main focus is on training health writers to report accurately on health issues and current health issues, and not be carried away by sensationalizing things as many of previous do, especially after the onset.
Thank you, Ankit. Good afternoon, everyone. Welcome all our distinguished panelists and all the participants from across the country, across the globe. Today, again, fortunately, in our India Immunity eSummit and Immunity Champions of India Award, we were able to get more than 500 live registrations on Zoom, and we have got few thousands of our participants on our Facebook Live, and we have got more than 100 shares where this program is running on multiple channels, social media channels. And today we have also entered the seventh episode of our Heal Die Samvad, and which we have kept on nutrition. It's also called Nutrition E Samvad, on food safety and nutrition security, and the collaboration between the development organizations and the government for building the nutrition efficiency in our country. I'll just give, I myself, Dr. Swadeep Srivastav, representing HEAL Foundation, welcome you again. I'd just like to give a brief synopsis of what we are and where we started. When this COVID started I remember in end of March 2020, and we thought that this is the right time to bring in the education awareness and to be able to fight the fear psychosis building up due to COVID. We started with a series of webinars, which got converted into a huge COVID safety movement under COVID Fighters COVID Safety Movement by HEAL Foundation in association with ICCIDD, and a great support we found from all sort of organizations, media houses, from Dr. Pandav's team, from our own team led by Mr. Shankar, Dr. Ankit, Chavi, and all others. And we have been able to bring in multiple stakeholders, multi-stakeholders, about 150 stakeholders who are doctors, key opinion leaders, experts from various fields. We have religious guru to film actress to women leaders to head of various organizations. Today we have head of top development organizations in the country, and we together have set up this program which has reached which has crossed 150 days of COVID education. And this time in the Suposhan month, we thought is the right time to build an awareness around nutrition issues. And we took up immunity as an issue because immunity is something which has actually popped up as one of the most important factor with respect to COVID management and COVID safety in India. And that's how this whole discussion under this India Immunity E-Conclave, first India Immunity E-Conclave, which will be followed by Immunity Champions of India Award, where under organizational and individual categories, about 13 categories, we have been able to get a lot of nominations from across the country from the organizations and individuals who have done exemplary work towards nutrition safety and security and towards contributing to the immunity factors. So with this, I hand over to my colleague Dr. Ankit, who will give an introduction of this distinguished panel. And this we'll start with the formally with the seventh episode of Heal Thy Samvad, which is on nutrition safety and security. And then Mr. Shankar will start with the Samvad along with our distinguished patron, Dr. Pandav. Over to you, Ankit.
First session for our summit today is Nutrition eSummit, Nutrition Security and National Nutrition Programs. For this, we have our first speaker as Mr. Vishnu Parajoy, Representative and Country Director of WFP. Mr. Parajoy brings 35 years of distinguished experience in development, humanitarian affairs, diplomacy, fundraising, and management in over 10 countries in Asia, Middle East, and Africa, including WFP headquarters in Rome. Our second speaker for the day is Dr. Aaron de Watt. He is Chief of Nutrition UNICEF India, National of Netherlands. Dr. Aaron has 25 years working experience and has been with UNICEF for over 20 years. He holds a master's degree in nutrition from Wageningen University in the Netherlands. Dr. Aaron has worked in the area of nutrition across sub-Saharan Africa in countries like Zambia, Malawi, Zimbabwe, Kenya, Namibia, and Nigeria, as well as UNICEF New York headquarters. Then we have with us Dr. Chandrakanta Pandav. He is the founder member of the Regional Coordinator of South Asia of International Council for Control of Iron Deficiency Disorder since 1985. Dr. Pandav was former president of Indian Association of Preventive and Social Medicine for the year 2007 and 8. He has also been the former head of Center of Community Medicine, AIMS, New Delhi. Then we have with us Dr. Tarun Bij, Country Director again, with 18 years of entrepreneurial experience in the commercial sector with 12 years in leadership positions in international development. As Games India Country Director, he has pragmatic financial and representative oversight of Gain India's footprint, including projects on large-scale food fortification, community management of severe acute malnutrition, workplace nutrition, production of fortified blended food, and nutrition research. Over to you, Shankar sir, to start the session.
Shankar sir, we can start with Mr. Vij. He had a hard stop at.
Yeah. Tarun, welcome to the summit. Tarun, I'll start with you because obviously you have to leave slightly early. So I would just like to ask you as an introduction, what has been Gain's role during this 6 or 7 months of COVID? What did actually Gain do, especially with regard to India?
Sir, overall, um, COVID obviously is a global phenomenon. It has impacted all of us. As GAIN and with our partners across the globe and in India, we've assessed this at four different levels. One is you've had severe disruption in income, and income for the most vulnerable is most severely impacted. So people who are already vulnerable are impacted the most. Second, food supply chains, fortunately, not that much in India, but globally, we've seen in other parts of the world, there has been disruption in food supply chains. Some of that we saw in the early days in India as well. And normally, when you have disruptions in food supply chains because of variety of lockdowns and opening of these lockdowns, it's the fresh fruits and vegetables, the more nutritious foods are perishable, and that is where the impact is more. And therefore, combining these two, uh, it is expected that the poorer and more vulnerable section of society defaults towards staple diets. Third is obviously our primary healthcare systems have also been impacted at some level. And with the announcement of various schemes, the rejigging of social protection schemes by the government, I believe some of our social protection schemes have also been tested because of the strain on them. So I think collectively as a country, this has been our challenge. And GAIN in some states has provided very direct relief to migrant workers and workforces working in tea gardens and plantations, and migrant workers in Bihar, in Karnataka, in UP, etc. But broadly speaking, I think our message through all our partnerships is the default towards more consumption of staple foods in times of such pandemics. We must continue our large scale food fortification work, which all development partners, not only GAIN, all development partners have been doing so responsibly and so much in coordination, not only in the private sector, but also the public sector with the social protection scheme. We should not get that interrupted. So whether it is with the vitamin manufacturers, the premix suppliers, whether it is with small, medium, and large scale industries, our work in the field on fortification continues even now. And that work we have, in fact, accelerated. And we are happy to tell you that in 20 states, as a direct consequence of our projects and programs, uh, fortified staples are available to in excess of 835 million people. That 835 is a back calculation based on the tonnages available and the average household consumptions. And so that is what we see. I think
A lot
I
of the
really want to
state
make.
governments, Tarun, a lot of the state governments did intervene during the lockdown period and gave some free kits to people, especially the most vulnerable who couldn't move out, and they were given free kits of say pulses, a little bit of vegetables, and what they use in daily lives. Did this help out to some extent in India?
Sir, I think it did. Every bit counts, but I think the magnitude of the migration is huge. I think all of us are aware. You have about 125 million migrant workers. I'm not saying everybody migrated back to the village, but yes, it was a serious problem. And I think the problem was more than we could reasonably handle in a short period of time. But I think different states picked up speed in a staggered way. And so overall, I think I'm happy to see that the response has been there. The response has been very specific, and there has been adequate direction given by the central government. But obviously, our state infrastructures have variability, and within states, our district infrastructures have variability. So there may have been some gaps, but overall, I think directionally, we've done a reasonable job with this.
But I think, as you said earlier, the biggest problem, of course, you could give pulses, you could give oil, you could give this, but perishables were a big thing, especially vegetables, because lockdowns really could have deeply affected the supply chain. Has this come back to somewhat a normalcy after Unlock 4, which the government announced recently?
I don't have an exact ground report, but it is reasonable to expect as the lockdowns have opened up, the availability, the price stability of perishables has also now stabilized. There were some upsurges and downswings in the early parts of the lockdowns, but now food markets seem to be working slightly more efficiently than they were, let's say in April, May at that time.
Yeah, and
And
also
so,
recently
yeah.
asked you this question of about recent survey being done by some civil societies in 12 states, which said that because the impact of coronavirus induced lockdown, half of them were found to be eating fewer items, less number of times to overcome the crisis. What are your comments on that?
I didn't get that question, sir, clearly.
Recently, there was a survey done by a group of civil society organizations, which surveyed about 5,000 plus rural households across 12 states in India. And they found that more than half of them have found to be eating fewer items than before, and especially to overcome the crisis.
Oh,
So what is your
absolutely.
comment on that?
Oh, absolutely. Absolutely. This goes back to what I was mentioning. In a classical diet and, addressing malnutrition, we say a diversified diet is the gold standard and have as many foods. And in the reality of our country and many parts of the world, we know that a good diversified diet is not at all times affordable, uh, particularly at times when the vulnerable section of society has had an income shock, and there is an availability shock as well. And so I'm not surprised at all at the observation that people were accessing and affording. So there are two components to this. Access was lower, affordability was also lower and therefore diets were going more towards staples than towards what we would call even a reasonably diversified nutritious offering.
But have you got a handle on how this has actually impacted nutrition?
So this has to actually, there is no specific study, but one can certainly estimate that when you're consuming a more narrow set of dietary ingredients, your micronutrient deficiency and other nutritional indicators will certainly not even remain steady. They are expected to decline.
That's
So
right.
I would reasonably expect that for some sections of the society, the nutritional status has been impacted. I think time will tell. There are a couple of studies or estimations, rough estimations say that every percentage drop in global GDP roughly pushes 700,000 children into more stunting. Dr. Parajuli is here. I believe WFP did a study and estimated that 140 million people would be pushed into extreme poverty, and that's a WFP World Food Program estimate, and that surely will have its impact across the globe.
Dr. Pandav, before Tarun leaves, I think you can ask your question before I move on to Bishoy.
Tarun Veej, as
Dr.
usual.
Pandav?
Yes, please. Tarun Veej, Tarun, as always, your clarity, content, and comprehension is superb. But I just want to bring out a very important point. Sadiq was concerned about my disappearance from Delhi. I've been in the field for the last 10 days, from 6th of September till 16th. So I've seen the ground reality in real life. We are barking at the wrong tree. The real question is at the policy level. While we covered some of the tidbits of the program, I think I want to make a plea that there has to be a dramatic, drastic, and immediate changes at the policy level. Who are leading the COVID-19 policy? We have people who are cardiologists, who are orthopedic surgeons, who are obstetricians. This is a game which requires epidemiologists, public health specialists, behavioral scientists, logical experts, and management. So I think that's the main problem. That needs to be addressed first, number one. Number two, I think the response to COVID has been exaggerated. It has caused more harm than done any good. More people are dying because of nutrition related disorders than COVID. So the government has to seriously take into consideration to get the right people at the policy level.
Do you have any question for for Mr. Tarun?
Question, I think we looked at the fragment. We have to see the total picture. We've seen it in isolation.
No, I'm asking if you have any question for Mr. Tarun.
Tarun, as usual, was in his area. He's very clear. He's very comprehensive. There's a content-wise very special. But Tarun, you're looking at a very narrow point. Look at the larger picture, please. That's my suggestion to you. I have no questions to ask you.
Thank you, sir. Mr. Shankar, if I could be permitted, one short insertion.
Yes.
I think with this COVID, since we're talking about it, uh, nutrition usually affects the severity of the infection. And
Yes.
so people who are nutritionally compromised are more likely to die. It's not increasing the likelihood of getting the infection, but if you get it and you are nutritionally compromised, you're more likely to die. I mean, that's just statistics. So therefore, I think within this entire COVID response, we must keep on highlighting that all the nutrition gains, and I know Aryan and Bisho, everybody will be talking about all the great work that has happened in Poshan Abhiyan, etc. I think we must do that, without any relent or interruption. So nutrition is key to ensuring we save human lives.
Do
Thank
you
you
have
so much.
any little, if you have any study or probably a little knowledge on which states actually did well during this period and which states actually lagged behind? Do you have any data on that?
Sir, I don't have specific data, more data. I only see the responses from various public sources. And I thought
Okay.
Kerala did a good job.
Yeah.
And there were,
I
I'm
just
sure,
want
other states as well.
I just want to add that the national and global response to COVID has been more dangerous and disastrous the way we are handling the situation. We are barking at the wrong tree. Naturally, the deaths due to nutrition disorders are much, much more than due to COVID-19. The global community must take into consideration that we are going in the wrong direction. We are going in the wrong direction.
Tarun, I'll just add one more thing because I'm from Kerala and I happen to get all those kits from the government of India, though I am well off in the sense that they made it compulsory that we should take all these kits, and they were quite, I could make out that they're all nutritionally good, and it was not just one of those government things that they gave. The items were good, the vegetables were good, all the things, and especially they divided into three categories. That is, the poorer got first, then the middle class, and then the next section, and the well-off got last. But then everybody got covered in Kerala. That was one good thing that this government did. So I think that
Kerala does
I'm
it so
speaking.
well in so many areas, sir.
Yes,
You
yes,
know that, even in primary healthcare, education
yes.
as well.
That's right.
Once again, Dr. Shankar, I want to reiterate that we are barking at the wrong tree.
Yes, we got it. Yeah, yeah.
I think it has to be loud and clear. These are not 150 days of COVID. These are 150 days of nightmare. And I'm calling on the basis of my field visit. 10 days I've been in the field. And the situation is extremely disappointing, distorting. It's going to be a global shame to us that we're a party to this particular exercise. Shame on us.
Yeah. Thank you. I think, Mr. Tarun, I think it's 4:30 or to leave for an urgent call. Thank you very much.
Thank you so much, sir. And it's an honor to participate.
Yeah.
Thank you so much.
Before I,
Thank
you very much. Thank you. It's a pleasure hearing you. Before I move on to Bisha, I think Dr. Panda was very emotional about it. What is it that actually upset you, Dr. Panda? Briefly, if you could tell us.
I repeat again, once and again. These are not 150 days. These are 150 days of nightmare.
Yes, what is that nightmare is what we would like to have. We'd like to know.
Wrong people giving the policy direction. I said that again and again. This is a game where the fish is trying to advise the rabbits to run. The rabbits is good in running. The fish is good in swimming. The fish better stick to their pond and start swimming. This game of response has to be handled by epidemiologists, public health specialists, nutritionists, behavioral scientists, management experts who are driving the policy level. I think it's time for them to retire and go back to their respective areas. I'm saying this as a very strong statement. Still,
100%, taken. Yes. I completely agree with you, and I think we are going the wrong direction. That way, unless we correct ourselves, there's a big problem.
Dr. Shankar, it's not a question of agreement. It's a question of revolution. This agreement has been fine, but it requires a revolutionary response.
I'll come to you, Vishoy. So UNICEF has been doing a wonderful job, and I will just come to recent UNICEF statement, which warned that an additional 6,000 children could die daily from preventable causes for the next 6 months. That's a huge figure, as the COVID pandemic weakens the health system and disrupts routine life. This will be the first time ever that the number of children dying before their 5th birthday could increase worldwide in decades. What are your comments?
Mr. Arjun from UNICEF. Sure, Mr. Arjun is here from UNICEF.
Okay.
Oh, sorry. He's there?
Yes. Good afternoon to you, and thank you very much.
Welcome, Mr. Arjun. Yeah, welcome.
Yes, thank you very much. Yes, not only that. I mean, let's actually look at India. According to the Lancet study last year of India, it estimates that 2/3 of all under 5 deaths in the country have malnutrition as an underlying cause. That Lancet article was using 2017 data and estimated that every year about 1 million children are dying. And out of that, then 2/3 because of with malnutrition as an underlying cause. That translates to 1,900 children every day. And that's in a normal time. That's not in a COVID time. And
Yes.
I think you're very right. Models show and models suggest that mortality rates can actually significantly increase. It says that acute malnutrition rates can easily increase with 10 to 20%. And I call this the secondary crisis, the COVID-induced nutrition crisis. Dr. Pandaf is very worried that actually the COVID-induced nutrition crisis might actually be worse, or the impact might actually be worse than the number of, at least the number of children dying because of COVID. I mean, Potion Abidjan was an excellent program. I mean, I think all of us got very, very excited about the system strengthening, the service delivery strengthening. Potion Abidjan was really a promise to the nation by the Prime Minister and everyone. I mean, the leadership that I've seen, I've not seen it in many countries before. Yeah, the leadership after launching a program all the way down from the Prime Minister, all the way down to communities. But of course, from February, it became very quiet. Yeah, and everybody was talking about COVID. And many of us were worried that Potion Abidjan was the end. And actually, I was very encouraged when we had the speech by the Prime Minister at the beginning of this month, and then the launch of Potion Abidjan. I'm very happy to see that nutrition is back. We now have Potion Ma, and we start seeing again the leadership, because I think that's the only answer we have and should have. We need the continuity of Potion Abidjan the way it was intended to be. We need to go back to where we were, at least in January, and then continue at that trend. And we're not there yet. I mean, the amount of data, you've been asking Tarun several questions about availability of data. Availability of data is limited. There's some small scale studies from CSOs. Data from a health management information system from Ministry of Health does show indeed that access to services, of course, in March and April with the lockdown was close to very, very, very low. But also in May and June, it has not come back yet to where it needs to be. So we see with COVID an increasing poverty, increasing in food insecurity, but also decreasing access and uptake of services. And that's indeed also what the HMES, the data shows. So what we need is, we need Potion Abidjan to come back with the same vigor, with the same leadership, with the same investment as we had before, with the trend that it was really pushed.
You said that this is likely to come to the normal levels by January. Do you think the journey has already begun?
My point is, no, things have improved. If you look at coverage services, it has improved a little bit. And of course it has. I mean, in March, April, there was a complete lockdown. Nothing was, very, very little was happening. Yeah, access to services has improved a little bit, but we're still very, very far from where it needs to be. And keep in mind that even in January, February, service coverage, in many cases, vitamin A, take-home rations, awareness creation, counseling on breastfeeding, was only reaching 30, 40, 50, 60%. We were still low in coverage. Yeah, Potion Abidjan was trying to increase the coverage, but because of COVID, it has always gone down. So for me, my message is, we need Potion Abidjan with even more energy, with more resources and more leadership than we had before, so that we don't lose the battle and that we don't lose the advantages that we have made since the launch of Potion Abidjan 2.5 years ago.
Mr. Aryan, my question to you is, yes, Poshan Abhiyan is definitely the flagship program of our Prime Minister and this government. And as you also pointed out, it started with a vigor and a lot of enthusiasm and was going in the right direction. But we have done about few 20-25 webinars, discussions in the last 150 days. And even if you look at the international reports, even what Bill Gates said, that this COVID, whether you like it or not, is going to stay here. Even if we do best, this COVID is going to stay here till 2022 for some time at least. And we are not sure about when things will open and get back to normal. So in this scenario, when we have to live with COVID, do you think that, yes, of course, coming back with vigor and enthusiasm and taking that to that level, definitely the government authorities and along with UNICEF has been one of the biggest partner of Poshan Abhiyan, what we have read and seen. So definitely you all are working together to bring it back. But with the limitations of COVID staying here, do you think there is any fundamental change required in how Poshan Abhiyan was created and how it was implemented? And fundamentally, do you think we need to go back, step back, and look at into and see how we can do best in these COVID times, which is
Yeah.
going to stay here for maybe another couple of years?
Yeah. 2 points. First of all, Portion Abidjan was based on an analysis of the challenges in the systems and in the service delivery. It's trying to address this pre-COVID, it was trying to address these gaps in the systems and in the service delivery. If you do your analysis now, yeah, you do your bottleneck analysis, your gap analysis, and you want to try to come up with answers, I can guarantee you, you come up with the same answers as Portion Abidjan. We do need all these, we have the right services, supplementation of micronutrients, breastfeeding counseling. Mothers need to go back for antenatal care and mothers need to deliver in hospitals again, which many mothers stopped doing that, or the numbers have gone down. That are the only answers we have and they are the right answers. The problem is that as long as we stay at a coverage of 40, 50%, you're not going to get your impact. We need to get that coverage back. We need the continuity of the service needs to come back. The intensity comes back. I mean, I love portion ma, but why don't we have 12 portion mas per year? I love breastfeeding week, but why do we have only one breastfeeding week? So we need the intensity. And of course, we need the quality of the programs. Yeah, and you talked about, for instance, the food that is provided in some of the states, the food that was provided through take-home rations is very, very good, very nutritious, dense food. In other places, there are some areas for improvement. So I would say that by design, the programs are correct, but they need to be delivered with full coverage, full continuity, full intensity, and full quality. If you don't meet those 4 components, and I call those components C squared IQ, coverage, continuity, intensity, and quality, you're not going to achieve it. You don't need new responses because of COVID. It's the same responses. We have to deliver them such that the frontline workers don't have the risk. So you don't have mass media, mass campaigns bringing 100 people together. Yeah, you have to do more door and door. But that are minor adjustments in the delivering of services. Overall, the set of interventions remain the same.
But the problem here is they have diverted a lot of these people from the groundwork to COVID. Yeah. And so that has affected this door-to-door campaign.
Exactly.
That is a major problem. Manpower is a big problem.
Yeah. No, and I think that's exactly what I'm saying. So the response is correct, but you need to do the response.
So and another thing was recently I saw a statement from UNICEF that because the emphasis was on COVID, UNICEF slightly got strapped for cash. They're saying that more cash is needed now. How are you now in the situation? Has it started improving? No, they said they need more funding.
I think everywhere I see it. It's not only funding, it is human resources, it's time, it's all the resources collectively as government and development partners. More resources are also being put now in the prevention of COVID, in the management of COVID. And therefore, we might have this secondary impact, this COVID-induced nutrition crisis. So definitely more resources are needed, not only for UNICEF, WFP, any development partner, also government. We also worry that resources reserved for the nutrition response are being moved to the COVID response. You already said yourself, one of the resources is the human beings, the frontline workers. Yeah. There's so many other resources. It's the time of the Prime Minister. Is he talking about COVID or is he going to talk about nutrition? It's the Minister of WCD. Is she going to mobilize her people to prevent COVID or is she going to mobilize her colleagues and her team to prevent malnutrition?
That's a big challenge.
So, Mr. Aryan, one more question, and the same question can be answered by Mr. Bishoy also on behalf of World Food Program. Sir, as UNICEF is an international organization and you have a visibility of what UNICEF is doing in other countries, Can you or would you like to share some experience post-COVID, where in one of the countries or any example where they have been able to re-strategize and been able to counter these challenges and come out as a winner? Any such thing is
Yeah,
there?
but let's be honest, there are no countries with the level of poverty that have already come out of COVID. So we're learning as we go. Yeah, but what we do know is that the countries that have come out of malnutrition, even before COVID, there were some things that you needed to have a comprehensive response, a multi-sectoral response, you needed financing, and most of all, number one, not number four, number one, you need leadership. Yeah, and I think that is what Porsche Abidjan brought. Abidjan brought leadership. And I think that is what we're trying to call, and I think this party also probably what Dr. Pandov is trying to say, the kind of leadership that we see and resources going to COVID, we need to have this kind of leadership to continue for nutrition. We know what works. We know it can work in India, but we have to deliver it with coverage, full coverage, every child, every mother, every corner, with continuity, 12 portion mass per year, 52 breastfeeding weeks per year, intensity and quality of services, C squared IQ.
Uh, Mr. Aryan, would you like to also pinpoint any comparison between how states are now coming back with their nutrition programs? We have a UP Health the Deputy Mission Director, Dr. Hira Lal, who is also in charge of the nutrition program. He's coming with us at 5:30 p.m. and later in the show. But any specific comment to the states responding to this situation, in your view?
I think two things. Of course, we always look at some states that are doing better. I mean, Kerala was being mentioned. Kerala is always doing on many things very, very well. And that has been traditionally almost, yeah? It's got to do with resources, etc. When you look at Portion Ma, you see that some states, you've seen a lot of things happening and good things happening, and some other states lagging behind a little bit. I mean, I can mention a lot of states, UP, Bihar, Chhattisgarh, Jharkhand. Yeah, you really start seeing a re-energizing pre-COVID, but now also again at this moment, this stage in the COVID response, a re-energizing of the nutrition response. And if you want to relate it back, why is that? It's because the leadership. The moment you start seeing the chief minister, yeah, or the secretary of a department of the OECD or health talking about nutrition, they start seeing things happening at community level as well. Yeah, so I keep coming back to the leadership, because leadership is a game changer in malnutrition. We know that from India, from some of the states that have been doing very well over the last many years. And we know it from other countries, from Ghana, from several other countries in Africa, Asia, Bangladesh, very nearby. You see that because of leadership, a change can be made.
So your key points are, one is that definitely due to COVID, the momentum of the Poshan Abhiyan is definitely affected in the way it started, and it is affected. And you also mean to say that it has also taken a backseat, and COVID, and a lot of things have taken a backseat because of COVID. Nutrition is one of them. And your message to everyone is that, particularly the government and the authorities, is that it should not take a backseat, because nutrition is nutrition safety, security for the population, and that also for a country like India is as important than preventing people from COVID. Otherwise, it will have a long-term devastating effect on the overall healthcare scenario of the.
Well, you can see it, as I say, behind me. It's about preventing COVID and preventing malnutrition. You don't want a child not to get COVID, but dying of malnutrition. That's what you don't want. You want both of them happening. I'm very encouraged with the way Portion Ma, September month, nutrition month, has brought back nutrition on the agenda again, from the Prime Minister to the ministries. And I see also chief ministers. I hope that is a restart of Portion Abidjan 1.2. Yeah, basically a restart. And I hope it will continue. And I hope it continues beyond September, so that indeed we're not going to get the COVID-induced nutrition crisis that many of us are actually worried about.
That's a very interesting terminology, COVID-induced nutrition crisis.
I just want to make a statement.
Yes, sir.
Today is the 17th of September 2020. Today is our Prime Minister's birthday. हम
Oh,
प्रधानमंत्री को इस जन्मदिन के लिए बधाई देते हैं. We wish him a long, happy, long life, a healthy life, and high quality life. Our Prime Minister, I call him as the public health practitioner, not only of the century, but of the millennium. Why? Because he thought of Swachh Bharat. He thought of National Nutrition Mission. He thought of Ayushman Bharat. He thought of Beti Padhao, Beti Bachao, Beti Padhao. So I call him as the visionary leadership, which Aryan has been referred to. He has been a visionary leader. Number two, I consider in life every obstacle as an opportunity. Every obstacle. I'm a member of the National Nutrition Council, which is the highest policy-making body. It's almost a year that we have not met. I have made repeated requests to the powers that be. 1 year we have not. We're supposed to meet every 3 months. Now it's almost a year. We have not met even once. Who's going to answer this question? Why have we not met? My colleague
so
Aryan has been very, very modest. When I met him on the very first day in India, we had a cup of coffee. There was a lot of things to take.
right, sir. So I'll now definitely
Rohit, please let me complete.
back to the
Rohit,
timing of the session, sir. Sir, very rightly said, sir. So
wait,
taking
please
from
complete. Let me complete.
the point Dr. Pandav has made, I would now like to come to Mr. Bishoy World Food Program. Sir, first, thank you for your patience.
Rohit, let me complete the statement.
Okay, sir, please, please.
On the very first day, he has been using the word C square IQ. Coverage, continuity, intensity, and quality. You're talking, it's not a new norm. He has been talking about it the very first day. If we had practiced that honestly, we would not have to face this day. So that's what I want to make. He's being very modest, but very honest about it.
Very valid point, sir. So, Mr. Bishoy, welcome to you for the second time in our HEAL.
Namaste. Thank you.
And thanks for your patience, sir. First, why don't you, before Mr. Shankar starts shooting questions, sir, can you tell something about World Food Program and the current scenario and how you are handling and what you're doing in India, sir?
First of all, I want to really compliment HEAL Foundation for convening this event. It's really, really important, and the topic we are discussing is extremely a priority topic, and I think it affects children. It affects mass of the population. So, and it also has a long implication. So it's very important that we are discussing this in the context of the World Food Program. By virtue, World Food Program relates to food and nutrition, and our emphasis have been from the very beginning when the COVID happened and lockdown started is to make sure that everyone gets adequate food and nutrition, and there is no gap. In fact, we began with advisory support to government to say that maybe they could take various measures on that, and then within the UN system, we also joined forces to work with FAO and IFAD together with UNICEF, and we started engaging with Empower Group 5 in a best way to provide the advisory policy support from ground reality, what's happening. And I must say there were very positive responses. And then on our own, from our programmatic point of view, we converted our program all zero in to COVID response and see the focus we were making on system reform and working on that PDS. So how do we really enhance it? We brought technology to see how the farm can be outreach to the market, farm produce to the market. We looked at some of the policy work on nutrition issues, the messaging aspects, and also making sure that it is preventing people from the COVID. So there is a knowledge about it, and also we started exchanging in terms of the issue of the midday meal and school children to make sure that there is an alternative way to help children with the food, right? Even in absence of the midday meal. So we started engaging with the government about it. So this constant daily engagement, we monitored in several states how the people who are receiving the food support, the increased ration, pulses, etc., or not receiving, how the agricultural market system is operating, how the farmers are selling this produce, and etc. I think those efforts were extremely valuable also for us to understand the implication. And I must say, there were a large number of people without ID cards and etc. and not receiving food support, but there are states were coming up with a solution. And we have been working on this EPOS, this universality of the ration cards across states, and then those elements really help people to access rations. And our effort also where to complement in a certain ways where we can provide a direct food support. We engage with civil societies, capacitating their response, etc. And we continued and intensified our the message on food fortification and and the value of nutrition. We engage in advocacy messages, and working more with the authorities behind the scene to address it at the state level. And the point you mentioned about some states, I must say again, the reference to Kerala, Odisha, they were doing a fantastic job. And I would also say UP was quite proactive in making sure that the people without ration cards receive the food, and there is no one left behind, and etc. They brought lots of flexibilities in it. In fact, as a part of our ongoing cooperation, we just signed an agreement with the UP state in terms of engaging self-help group, women group, and producing nutritive food, and also scaling up rice fortifications for midday meal program, diversification of food rations, and etc. So these have been, in a summary, our efforts. And there was question referred before about globally. I mean, sadly, this COVID is unprecedented globally. It's a global issue, not only India. And I must say, the feeling I have is, this is my 11th country I have worked in, and I've traveled in over 100 countries and seen program, and the proactiveness of the government in terms of multiplication of ration card and continuation is very positive in the scale of the country, India. Of course, there are areas continuously need to improve. And also, I would say the civil society's involvement, the private sector's involvement, 16, 20 million meals were served with kitchens, and women groups, self-help groups, volunteers, really serving it. I think that is humanity for you. And, all of a sudden, from one day to other, people have no job, no income, and they don't know how to feed their families, see? It was unprecedented. And the message, for example, in UP, the chief ministers coming forward and really challenging and saying to identify anyone hungry, and we would really reach out and support them. Cash distributions to the farmers and others as a complementarity, and efforts to bring supplies from farm to the market, helped by these states. If there were, I mean, I remember in some instance there were gunny bags not available to bag supplies. There was so much harvest was going on, but they were really changing rules to facilitate this. I think India is a continent, and you need to see that scale and the magnitude of the issue they handle it. But what I would also say is the threat of global hunger and malnutrition in India is undoubtedly rising because of the COVID. People have lost jobs, they have lost their income, and So increasingly, if you see the list, the percentage of people collecting food ration at the early part of the month is so high. In the first week of the month, everybody has collected their supplies. And that shows the necessity and urgency of and the value of these food support from TPDS and others. And also the flexibility, I would say, the government has introduced in terms of take-home rations, so midday meal and etc. is also and ICDS. They were even delivering the food supplies to the mothers under ICDS program at a home level on those who have been red zone and etc. Lots of efforts and a lot of engagement. I mean, our program is modest because and more catalytical and more in a way supporting and working with the government rather than us, with huge funding and etc. I mean, in other countries, you would see WFP with the truckload of food and other things because there is a need. Here, the government is playing that role. And I think I must also say the agricultural production on self-sufficiency India has reached over the 20, 30, 40 years of green revolution, and those big effort is really commendable. There was.
I'll just ask one specific question, Mr. Bushra, this that your Director of Emergencies had recently said, to quote, "The impact of COVID-19 on people is demanding us to step up and scale up our efforts to ensure that more food insecure people receive assistance. By acting early, we can prevent households depleting assets and livelihood," unquote. In this context, what I would like to ask is, how did WFP address the migrant population issue in India when it really was in its peak?
Let me say that, I would not say we address as WFP. I think I would say that we work with partners and government to help, reaching out with food and other support to these people. And I must say there was enormous challenge, lockdown and risk of COVID, etc. And overall the number has globally has doubled. The worst hunger level. I mean, they're talking about there was a reference made 140 or 170 million. It's about 250 million, and ILO is estimating that nearly 400 million people will be out of jobs. So therefore, you are right, Mr. Shankar, and I think
you could deliver ration to the households to their doorsteps. But when the household itself moves across India, it's very, very difficult for you to address this issue. I think that was one.
Well, that is the challenge of that is the technology. You see, the whole this one ration, one card system, EPOS, is precisely to address.
No. I'm not speaking of ration. I'm speaking is when these people were on the move, the household itself moved. So the problem is that you couldn't. There was a delivery issue. The people that you found in one spot in one day they were there in another spot. So delivery was a big issue. The supply chain got challenged, and even identifying the migrant population who really needed help was a big challenge.
I totally agree with you. I mean, we were not as an agency involved in distributing food.
No, I agree. You're not involved. Of course, I'm just asking for your comment. That's all.
Yeah. But it has been a challenge. It has been an enormous challenge. These people have just moved out of the place. And I think at the beginning there was a lot of suffering. I must say, people went hungry, and you heard about people dying of hunger and thirst and etc. But then it was really scaled up. And as I said, instantly establishing kitchens, serving that. There were groups really running to deliver food. That's why I was really complimenting the civil societies and private sector really joining hand into this process to help. And I mean, in every country, the first level of respondents are the communities and the volunteers, and I think their role has been really fantastic. And also the government has, I think, opened up arm to bring the civil society to join. These various empower group which was set by the government was a really big help to ease out different areas of bottlenecks, strengthen partnership, and support it. And also the huge amount of food stock the government had, the warehouses, that was also a big help. But the whole experience has been precedented. I think the important thing now to do is to look at it, how do we take it from here? Because the people have suffered, so the important thing is continued increase of rations, availability of that increased ration which has been allocated. I think until November the ration is there. I have a feeling that they would continue to need that for a bit longer period. That's number one. Number two is stressing on the fortification of meals, intensifying complementary food and support to the children, really. And also we need to watch and monitor the vulnerability, rising vulnerability. And some of these states are worse than others. And there we really need to pay an extra attention. And then the other thing is food diversity. I would really strongly encourage even provision of money, cash to the mothers as a way so that they can buy some vegetables and have easy access of money to help diversify their food intake. And finally, what I will also say is we need to continuously work on improving the system, the long-term part of it. That is, like yesterday, I had a conversation with the food secretary. We were talking about how do we converge these three most important safety net programs the government has. It covers 1 billion people. They spend about $23 billion per year. I mean, enormous scale and magnitude. How do we make many countries can only dream this scale of engagement, but how do you improve? How do you target? How do you maximize the benefit? And how do you reach out to the most needy on timely basis? And there is reduction of leakage and etc. So I think these are the elements we need to continue to work on, and that's what we are working on. But meantime, I think because people are vulnerable and people are really need the help, so little extra rations or extra support to these most vulnerable groups, and then also intensifying the fortifying efforts and etc. I think some states have really come up. I mean, I am very impressed about this cooperation which we have now signed with the UP, Honorable Chief Minister and other. We're putting a little support, and the government of the state of UP is putting 1,200 crore to scale up these things. That's what Kerala did. And I think these are great examples.
Yeah, and I just, before we conclude, actually we are running out of time, and I need to really ration some time also because it's very crucial. I'll just conclude asking one question is that according to WFP's estimates, new estimates, during COVID shows that the number of acutely hungry in the countries where it operates could increase by a whopping 270 million this year. That's huge number, an increase of 82% figures. Now, briefly, how is this being addressed before we move on to the next session?
Okay, very good question. Because we have a multiple approach in responding to this. One is direct increase of food support. In fact, my boss, you will see it. One day he himself had a COVID positive, but that didn't stop him run. One day he's in Ethiopia, another day in South Sudan, another day he's in Berlin, or another day in London to get the money. And then we help to set up, this response to help the humanitarian worker. We run planes, we run hospitals, etc. So mobilizing resource first. The second is identifying where the need is the maximum, and then working with the government in that. And also pushing government to engage and put more money to help their own citizens. Sadly, another biggest problem in some of the country is the war, the conflict. Syria, Yemen, South Sudan. So addressing those element of conflict is also really fundamental, important to reduce the burden. And finally, working on a structural issue. How do we find a long-term solution? Because emergency relief and all these will never address the problem. The point which Arjun mentioned about it, I mean, India's example of this Poshan Abhiyan is fantastic. And intensifying from where it is, left to reach out and magnify, not to make it event for a few days, but continuously stress on. And also, like some states, I have been to Kerala, I have been to Odisha, I've been to a few other states, and I've also been to Jharkhand and UP, some of these places. I mean, you cannot compare these programs. One is like in the best example, other is the worst. So we can learn from India, within India itself, and work on. And we're trying to do that to improve out of these various programs.
Dr. Pando has got some question for you. I think with that, we'll move on to the next session. Yeah, Dr. Pando.
Yes, sir, please, sir. Then I'll continue.
Earlier, that I considered every obstacle as a learning opportunity. The learning opportunity globally we have as a result of COVID are three things. Number one, a strong, harmonious, cohesive relationship between agricultural security, food security, and nutrition security. Number one. Number two, we will have to continue to depend on locally grown foodstuff of all times to come. And number three, thank you for the time given.
Thank you.
So before we end, thank you, sir. Wonderful, sir. I'll have a last question with Mr. Aryan D. Watt. But first of all, Mr. Bishoy, thank you so much. What your message came out very clearly. India is changing, and one of the poorest and backward state, UP, is changing. We'd like to know more about the UP program which you're launching. We'll send a separate email to you with few questions, because all these reports are very widely covered by media across the country, and we'll see that such important takeaways are carried through the media to the people and to the important stakeholders. My last question to Mr. Aryan would be, before we conclude this session finally, is, sir, what is your key message of the day, particularly what next? As Mr. Bishoy said, how do we take it from here? Like, for example, if you look at various situations, the job index and all those overall economic problems and economic downfalls, which almost all over the world countries are facing, India is also facing. But one of the index which is worrying is the hunger index, which is further gone down. I was just reading today only, hunger index going down further. So what is your recommendation to multiple stakeholders, and your ending message, sir?
Thank you so much. First, I think so far we've all talked a lot about the government. Yeah, and of course, there's a lot for the government to do, and I think we've been focused on that. And I think your last question was stakeholders, and I think there's all stakeholders. And we need to emphasize that as well. At the end, who is feeding the child? That is the parent. Yeah, who's putting the food in the mouth of the mother or the father? That is the family, it's the community. So we should not only look at government. And I think we've talked a lot about government in the last 1 hour. And I want to emphasize a few other. Parents, communities. They have a responsibility to learn about nutrition. Nutrition is not about eating and filling the stomach and getting rid of hunger. Nutrition is about the right food, the right nutrient-dense food that make you grow, strengthen your immune system, makes your brain grow as a little child. So parents, communities have that responsibility. Private sector. Imagine that every company in India would, I called it, use their ACE card, yeah, the primary card, that ACE card. Imagine that every company would educate their employees about good nutrition. That they would try a little bit to educate their customers or their clients. Imagine that they would contribute to educating the communities in which they work. That doesn't require huge investment. Many of these kind of things can be linked with their business. But the impact of companies taking that responsibility and feel responsibility to do that, to educate, to create knowledge and understanding of the importance of nutrition will go such a large way. Imagine that every company in India would do that. For me, nutrition is too important to leave it to government. Besides that, I don't think that government can even do it alone if they were trying to do it. We need everyone to get involved. That's why the Prime Minister is talking about Jan Andelen. For me, it goes beyond Jan Andelen. It needs to be everyone. Private sector, civil society, the people, the communities, the government, academia. Together, we can make that change in India. India has made many changes. You've got rid of polio. You've changed so many things. Malnutrition is not rocket science. You can shoot rockets to the moon. You can shoot rockets in the air. Malnutrition is not rocket science. We know what needs to be done. Now we need to do it at a large scale. And everybody needs to get involved.
Thank you. Thank you. Mr. Mr. You have 1 point to make. Then we'll move to the next session, please.
Thank you very much for this opportunity. I think I want to take it from where Arjun left, the involvement of private sector. In fact, we are really delighted in WFP. There are, a number of private sector, they have joined with us to support and address some of these concerns related to malnutrition and that concern. So we need to show more private sector the value of engaging into these areas. I want to name few of them who have been a partner, like Cargill, General Mills, Ericsson, Sodexo, Goodyear's, and etc. And there is this conception at some time that there is enough food for everybody, so there is no hunger and etc. In fact, during these the mass movement of migrants, we realize how much hunger is there, that hidden hunger. And really, we need to invest more on advocating on the hunger, because availability of food in the country doesn't mean food secure or nutrition secure. So you need enough to eat, but then you also need a diversified foods for different body requirement. A pregnant woman would need differently, nourishing mother would need differently, a child would need, growing child would need differently. So we need to invest more time in advocating and communicating these, and also making some of these food suitable to these various requirements among the needy population. Thank you very much.
Thank you. Shankar sir.
Yeah, thank you. I think it has really been as you rightly said, you need to find the right partner. You need to also scale up the activities, because COVID is a special time in which we need special thought. We need a special action. So I think the entire thing is, one key issue is that you need to have good manpower. You need to scale up your you're in the sense that everybody, the government, everyone, and to see and to address, as what Mr. Arun said, it is not just filling up your stomach. It is question of nutrition. It is question of the needy, the people getting the right nutrition so that this is not affected. We have gone back in time. We have gone back in clock, but then we need to set this right, and hopefully, say by January or February, we will somewhat reach some level of takeoff, so that we come back to the earlier levels. That is our hope. And thank you very much for your input. Thank you. Excellent input from all. Thank you very much. Sudeep.
Thank you for the wonderful session. Now with this, I'll take the opportunity to introduce the next session. The next session for the day is the immunity conundrum, lessons learned. This session, we have with us Dr. Sujit SR. He is nutritional medicine specialist from Devon Wellness. Dr. Sujit has specialized in nutritional medicine from Australian College of Nutrition and Environmental Medicine and carries a rich experience of over 15 years. He has developed a unique, proactive, predictive, integrated, and science-based model of biological medicine and is a pioneer in the field of health and wellness in the world. Dr. Sujit has defined wellness as the most scientific and evidence-based medicine. Then we have with us Dr. Kriti Soni. She heads the formulation development at Dabur Research Foundation. Dr. Soni is an alumnus of Jamia Hamdard and holds a PhD in pharmaceutical sciences. She has been awarded gold medal for her achievement during her master's degree. She has worked on several projects for development of novel formulation in the areas of organ health, psoriasis, hypertension, eczema, erectile dysfunction, pain management, etc. Then we have with us Ms. Manju Chandra, clinical nutritionist and founder of Manju Wellness. Ms. Chandra is a functional nutritionist and wellness coach, speaker, and author. She has worked for the leading hospitals of India, namely Max Healthcare, Manipal Hospitals, Columbia Asia, and many more. She is also the founder of Manju Wellness. She has been a keynote speaker at various public health conferences, scientific discourses, and symposiums, including events at ASSOCHAM, FICCI, and ISMA. With this, I'll hand over to Ms. Manju, who is also a host for the day and a key speaker along with Chandra. Over to you, Manju.
Thank you, Dr. Ankit. Good afternoon, Dr. Swadeep. Namaskar, Mr. Shankar sir. Kaise hain aap?
Namaskar, glad to see you. I think this is the third time or the fourth time we are being together. Yes, thank you very much. Glad to see you.
Glad to see you also. Good afternoon, Dr. Kriti and Dr. Sujit. Welcome to this session. The session is titled The Nutrition Conundrum, and I was listening to all the speakers just before we moved into this session. I must say it was quite a lot of learning, and the type of panelists that you all could, Dr. Ankit, you and Swadeep sir, you've been able to put together was really nice. Anyways, this session, I'm unable to see Dr. Sujit and Dr. Kriti. We do have them on board. Yes? Okay, fine.
We have them.
Yeah, okay.
Yes.
So, while we were going through this pandemic, all of us, the buzzword is immunity. Everybody is talking about immunity, but even as nutritionists, whose primary role is not essentially immunity and whose primary role and functional nutrition is more about cardiometabolic disease and more about weight and wellness and things like that, we had this question coming to us almost on a daily basis. Everybody coming in to us to understand how nutrition could fuel immunity. And that will be our discussion for the day. We've done enough in these last 6 months, and there are a lot of learnings that have come out from the advice that has been given, from everything that is available, from what doctors have been prescribing. I'll just give you an example. We use something called high dose vitamin C. So one of the ways to essentially destroy any form of pathogen is to use antioxidants, and high dose vitamin C is a very potent antioxidant, and it has been used across the world in ICU settings, in all forms of clinical settings, both in oral and in an IV form. And but this was not something that was discussed before, in terms of immunity. So there's been a lot of new learning. There's been a lot of new formats, new nutraceuticals, new herbs and botanicals that have come into the space. In fact, I was reading a report which spoke about the rise of the nutraceutical sector, which has seen an unprecedented rise of around 228%. That's the rise the nutraceutical sector across the world has seen in the last 5-6 months that we've been battling the pandemic. I therefore invite Dr. Sujit, and my first question is to Dr. Sujit. I also know Dr. Sujit personally very well. I'd request him to explain to us how immunity and nutrition are really correlated at the biological level, at the cellular level.
So thank you, Dr. Manjuri. Thank you all the entities and the program coordinators, especially Shankar sir. I have not met you directly. I'm so sorry, though you are from Kerala. I miss you. But with due respect, let's start the program. It's a very debatable topic, and the heading which you have given to us is still a confusion topic, even not only for the doctors, not only for the people, the public, the entire society, the entire world is now looking behind this word called as immunity. As we know, it came from a Latin word which says an exemption from almost for the public services, which you people were discussing. So, but as we progress on the thing of immune system, there are a lot of multidimensional factors which are trying to manipulate the word called as immune system or immunity, like boosting an immune system, suppressing the immune system, etc. But as a doctor who is dealing with these type of cases, let me tell you very frankly, some of the co-doctors who are also present present in the panel, with all due respect, than just increasing the immune system or boosting the immune system. As I already say, the best word to use is to balance the immune system, because we have different layers of our immune system in the human body. The primary thing is, I'm not a psychology doctor, so I'm not talking much about the mind, but the primary thing is our thought process itself. The worries and the tensions which we learn and read through the magazines, etc., even the news channels, etc. And then comes our physical body, where the skin is the factor which is primarily defending almost all the pathogens. Then comes the mucous membrane, the mucous secretions, which are trying to destroy almost all the viruses and bacteria. Then it bends, defending these areas, when it reaches the bloodstream, then the process starts to happen called as inflammation, where the WBCs, etc., the other panels happens to start. So if you talk of immune system, you have to correlate always the word called as inflammation. Inflammation is not a negative sign. If someone says inflammation, because inflammation is the word which is used centuries before by our pioneer called as Celsus. He described in the 4030 what is inflammation, how the inflammation occurs, what are the signs of inflammation, etc. So if a pathogen is invading us, the inflammation is the key factor. I don't misjudge immune system, because immune system is innate as well as acquired, have a reciprocity. It's a give and take mutual understanding policy, concludes as a whole with a process called as inflammation. So if the inflammation is very perfectly balanced happening in a human body, he or she comes out of this virus or bacteria or whatever it is in a very peaceful way. If the inflammation is not happening in a very settled or peaceful or in a particular point of it, it expands and it destroys the human body. That is the message which I have to give to you. So it's not the increased or boosting immunity, it is the balanced state of immune system, which we all want to establish on.
Yeah, that's very well said, because we've also been pointing out to all these topics of boosting immunity and rejuvenating immunity. As you said, it has to be balanced. The autoimmune conditions which we know of, which are the reason for heightened immunity, is not we want what we want to put a person in. We want a person to have a balanced immune response to react in the right amount to any pathogen. Having said that, as you were talking about inflammation, Dr. Sujit, we, because today's topic and today's discussion is more about nutrition and nutritional science and immunity, uh, can you pinpoint what is the right modality, or let's say, can you pinpoint what are the mechanisms biochemically which are dependent on nutrition that will affect the immune system per se? What are the biochemical reactions that are nutrition based in a big way?
You're asking about the nutraceuticals, or you're asking about the
I'm
treatment?
asking about nutrition in particular. If a person is not well nourished, what is the biochemistry that goes wrong, which causes the immune system to get suppressed?
See, the previous session has a very good impact on this question, actually, because we were talking about the undernourishment, malnutrition, etc., even from the children's perspective of view. If we want to think about optimal health, I'm so sorry. I respect all the establishments as well as the supportive factors. But if you want to go something beyond an optimal health, we have to really work on these factors, because an optimal health can be established by a high nutritive way of life. It's not actually an expensive way of life. It's actually the quality of way of life. For example, there is something called as American diet, which we were trying to implement, but now the system has changed, because American diet has already been said that it's an inflammatory diet, which we had seen most of sugary diets, fast foods, junk foods, donuts, pizzas, etc., which made a lot of inflammatory markers in the body. Inflammatory markers like cytokines increases. Cytokines, people are behind cytokines also now. now. Let me tell you, there are good cytokines as well as bad cytokines. That means pro-inflammatory cytokines as well as destructive cytokines are present in the human body. And if we want to do a healthy lifestyle, we have to go in something called as greens, beans, nuts, seeds, etc., which we locally purchase, locally cultivate, and then that has to be implemented for a healthy way of style.
Dr. Manjari, sorry to interrupt. We have a small interruption at about 5:30 p.m. where we have the additional managing director of National Health Mission UP joining in and talking about a Bada nutrition module and few other things what this UP state is doing. So if you can continue with Ms. Kriti Soni, and then we'll continue with the discussion post his keynote.
Absolutely. No, no. Thank you for that information. We did know that. So we'll have to keep a tab on the time also, of course. Dr. Kriti, as we were discussing, we've seen a huge sale. Everybody has been walking up to stores and picking up a little supplement to keep themselves safe or keep their immune system in high. So because you are in the formulation bit and because you've been into nutraceutical formulation, can you throw some light on what is the quality aspect of nutraceuticals? Because you're an expert in formulation, people are confused whether they should pick this zinc or whether they should eat this, or which is the best formulation combinations of nutraceuticals. So can you throw some light on the quality bit first?
Yes. So, in alignment with what has all been discussed so far regarding nutrition and the inflammatory cytokines, interleukins, which are upregulated in the body during inflammation events. So, what happens is that there is a need for certain herbal elements which will help us, mitigate that stress which is induced in the body due to inflammation. So, talking about the quality aspect, I would like to, introduce the concept of nutraceuticals, that how it has, emerged in a big way, and what are the regulatory bodies in India who regulate the quality aspect of these nutraceuticals. So, the major heads under which these products lie are the FSSAI, who's the governing body for major nutraceuticals. And for the vitamins and the other mineral supplements, there are certain areas where Drug and Cosmetic Act and the pharma sector plays a great role. So what happens is that there is a prescribed limit which has been assigned by WHO, ICMR regarding the dosages, or say the daily intakes of these micronutrients and vitamins. So that has to be adhered to. And apart from that, what FSSAI recommends is that they have a whole appendix, or I can say they have a whole gazette where they have herbs which are recommended to be used in nutraceuticals as per the safety of usage. Like they have a history of 30 years of safe usage in India, and we know that being from the Indian subcontinent, we know that our Ayurveda and our ancient literature is endowed with a lot of herbs which have their very potential benefits and important uses. So, talking about these quality aspect, it is very important that the geographical area from which these herbs are sourced. Like, for example, when you see the advertisements these days, you hear a lot about Salem ki haldi. So the reason why these things have come into play, and why there is a lot of stress on the geographical source and the phytoactive which is present in the nutraceutical, is because the whole activity of that herb is attributed to the phyto ingredient which is present. Like for example, curcumin has curcuminoids, which possesses a lot of antioxidant property. It also has antitumorogenic properties. It does have a lot of effect on the immune system because it boosts the immune system in such a way. I would say that boost is not a right word, because what happens is that the commercial aspect of the advertisements and everything is supporting a lot regarding boosting immunity, because that word creates a level of optimism in the consumer's mind, that this, by taking this product I'm going to recharge myself, but to some levels. But it's always about maintaining your immune system, because like every cell in our body has a lifespan, these cells do have a lifespan. Like we know that RBCs have a lifespan of 120 days and so on. So the T cells, the B cells, the interleukins, cytokines, they do, they keep on regenerating, they keep on dying because of the environmental effects, the stress levels, the nutrition that we take. So it's very important that, by different means, be it the nutrition, be the micronutrients, minerals, or the herbal components, we keep on, maintaining these cells so that we don't fall ill, or the tendency to fall ill goes down. Whenever we are exposed to some antigen, our body has that strength and the antibodies are being produced to fight the infection. So all of it comes under this the greater purview that the phytoactive, which is responsible for a particular action in the body, like for example you spoke about vitamin C. So we have a lot of sources of vitamin C in our fruits, in our vegetables like amla, the citruses. But the thing is that we are not able to get that benefit by consuming even 1 kg of oranges at a time, because the content in those natural fruits or vegetables is so low. That is why the need for nutraceuticals has arise, and has is on peak. And what happens is that by these nutraceuticals we are able to get lots of benefits in a single pill, or a very compliant format, like a drink or a mouth dissolving tablet or a mouth dissolving strip, which is very convenient for the user. So the most important parameter is the phytoactive principle that is present in the nutraceutical. And apart from that, the amounts of each of the vitamins, which is as per the RDAs and the ICMR and WHO recommendation. There is a great need to monitor the heavy metal and pesticide content of these, because the cultivations wherever they happen, at times what happens is that they're exposed to a lot of pesticides, which comes into the food chain in some manner. And from our studies, we know that there is a lot of biomagnification happening, accumulation of these harmful pesticides and heavy metals. So there is a big need to monitor the quality in terms of the content of the heavy metal pesticides, so that they don't cause poisoning. And apart from that, the marker content, that is the phytoactive principle.
Yeah.
So this has to be monitored very carefully.
Dr. Manjri will continue with this discussion, and I will request Kriti and Dr. Sujit to please stay on before we take the final questions and we move on to the next session. We have distinguished panelists from next session also here. We just wanted to inform you we are running late by 10-15 minutes. Please bear with us. Now I would like to welcome Dr. Hira Lal. Sir, you're there, sir, Dr. Hira Lal?
Yes, yes, I'm hearing. Yes, yes, I'm audible. Yes.
Namaskar, sir. Namaskar. Welcome on behalf of HEAL Foundation. I am Dr. Sadeep Srivastav. I have with me Mr. R. Shankar, President of HEAL Foundation. I have with me Mr. Pandav. Dr. Pandav की तरफ से भी आपका स्वागत है, sir. And he is just going to join us. We have a distinguished panels since about 1.5 hour, more than 1 hour discussion we had. We had distinguished panel from UNICEF World Food Program and Jane, and distinguished experts and nutritionists from Bangalore, Dr. Sujit, Ms. Kriti from Dabur Research Foundation, Mr. Manjri Chandra, leading nutritionist from Delhi. And today the topic, then the session on this the grand session on nutrition. And we thought it would be very relevant to invite you. And my colleague, Dr. Ankit, will just briefly give a introduction through a slide about you for everyone to know. I know we have done a lot of research on you. Also, Dr. Pandav and team has also told about you. And particularly, we would like to talk about your how, because we had just last week in our last Heal Diet Samvad, we had your health minister Raja Jai Pratap Singh also in our session. And sir was particularly highlighting on the various other programs like vaccination program, how during they had taken a back seat in COVID times, but they have now come back. Similarly, UP Health Nutrition Mission, which definitely would have been impacted by COVID and come back. So we'd like to listen from you, and also like to listen from you the Banda nutrition module. A lot of excellent work you have done in Banda, but would like to definitely listen to you on the nutrition module, and then we'll move on to our next sessions and discussions. Ankit, please, if you can introduce Dr. Hira.
Dr. Hiralal is Additional Mission Director at NHM Uttar Pradesh. Dr. Hiralal came from a humble background to serve one of the most prestigious services of the country. Being a keen learner, he recently completed his PhD in April 2020. He plans to do more research, role of communication in achieving good governance as he to stay connected with the study. Earned a certificate of Advanced Study Leadership in International and Non-Government Organizations and MPA degree from Maxwell, USA. He learned in depth how UN, Oxfam, UCED, etc. function. being a social and malnutrition leader as a who studied NG in detail.
So, sir, of course, my first question, and to better tell a bit more about your excellent work, what you have done when you were at Banda, wherein you also brought into, you were also covered by Limca Book of Records for breaking some record, and then you had done an exceptional work on the nutrition front there at Banda, and you were also awarded the best election officer at that time. So a lot of big achievements and laurels, sir. So, but to start with, sir, can you tell about the nutrition mission of UP, how much it was affected by COVID, and what all measures you have taken to bring it back, and how it is doing now?
Actually, I would like to say, actually there is network problem. Sometimes voice is breaking. So I would like to uh, caution you. Actually, I will start my point from the Banda.
Okay.
When I went Banda, so I got a call from a journalist from Times of India. She told me, she was known to me. She told me, Bhaiya, you are going as a district magistrate. So there is a problem that is called malnutrition, and it is a big problem, but nobody is knowing, even collector is not knowing. And UNICEF has done an experiment a year back, and I had covered that. So I am bringing this information to your knowledge. This was the point which made me to work on this issue, and today I am here in a position to deliver my talk. So first point is that around 47% malnutrition was there in Banda, but this is not known to many and not known to even district magistrate, not, and nobody was serious. So first of all, with the pointed knowledge given by that journalist, I made it a issue. If I used to count for the biggest problem as a district magistrate of Banda, so malnutrition, water crisis, there is a local problem of Anna Partha, likewise economic problem, unemployment problem. So within top three problem, I used to speak in different forums. What is the three big problem of Banda? Annapartha, water crisis, and malnutrition. So slowly and slowly, first I made malnutrition a issue of public by making them aware that this is the issue which is not known to public, and if it is not known to public, public is not owning this issue. So first thing what I did, that I sensitized the public so that it become a issue of the public. So that is the first point on which I worked to get the success. One point.
कौन सा साल था सर, कौन सा साल था ये?
ये साल था 2018, 2018. I joined August 2008. So this is the situation in every district. So we should all do this thing first, and I will thank here Salvi Sarda, journalist Times of India, who sensitized me through that particular news. Thereafter, I called from her that news. Then I gave that news item to my UNICEF consultant. I told that you study it, and it was done in a particular block. That block is named Naraini block. Implement it in whole district, and we made a meticulous plan with the help of UNICEF, and we implemented. The second point,
I think we have lost Dr. Hiralal. He was talking about the exemplary work what he as a district magistrate has been has done at Bada district, a small district near Bundelkhand, and changed the whole nutrition scenario from undernutrition, malnutrition to one of the very developed district with respect to the nutrition indices. I think we have lost Dr. Hiralal. So, Dr. Manjri, over to you. So, you can have your last question with this panel, and then we can, you and Shankar sir, we can move on to the Ayush session.
Yes, absolutely. Yeah, one more question for you, Dr. Sujit.
Sorry, Dr. Hiralal, sir. Yes, sir.
So, okay, actually, I told in the beginning ki there is network issue from your side as well as my side. Okay, so networking is a problem right now. Anyway, so first thing what I did, I make malnutrition a issue. Taking the journalist into confidence that you please publish this news on this malnutrition, so it become a issue. One thing. Second thing, how to manage the resources and funds. So I took the help of convergence participation. So I took the help of all my departments, and we gave every department the responsibility, and I started monitoring weekly basis. So, and in that weekly monitoring, we use to sort out the problems, we use to facilitate, so that our vehicle of this malnutrition reduction should not stop, it should pick up the speed, and it worked well. And in the first phase, only for the first time and in whole UP, I as a collector gave 35 lakh rupees from mining fund to give some supplementary nutritious food to the kids for a week. And rest thing, we managed, we allotted different activities, different actions to the department. For example, NRLM, schools, in there we constructed portion batika, so that nutrients, greenery nutrients they can get from there. If there is a poor child, so district supply officer was given the responsibility that we wish to see the ration card as early as possible, so that they should get the required nutritious food or ration. So likewise, we connected all more than 10 departments. Every department was given a clear responsibility. You will do this, you will do this, you will do this. And every week we monitored it. And in monitoring and evaluation and in strategy making, UNICEF was our technical partner, and it worked well, and reduction came, malnutrition reduced to a greater extent, and that's why we got this position that Bada Suposhan Karyakram was a successful. So this is in very nutshell.
So, last question to you, sir. कनेक्शन का सर प्रॉब्लम काफी चल रहा है.
Two main departments, medical departments and ICDS departments, and there is a not 63, not 63, 36 का आंकड़ा होता है, 36. So I converted the relation of 36 into 63 and continuous monitoring. And if a collector will monitor anything passionately weekly to get to see the results, that worked well. This is all in very nutshell. That is the Bada Suposhan model.
इस लर्निंग से जो बांदा की लर्निंग है, आज आप यूपी न्यूट्रिशन मिशन में बैठे हुए हैं, तो इसको कहाँ पे यूपी गवर्नमेंट इसको किस तरह से अपने लर्निंग से या बहुत सारी और लर्निंग से कहाँ इसको और किन डिस्ट्रिक्ट्स में प्रायोरिटी पे इम्प्लीमेंट कर रहे हैं यूपी?
I would like to let you know कि as I have been told by the UNICEF, since UNICEF is partner with the UP government, and in 5 or 6 aspirational districts, in 5 or 6 aspirational district, they are implementing, they are replicating this model.
Brilliant, sir. Brilliant, sir. So, after sir, we can have a separate session on it because it's very elaborate, and that's the point what the World Food Program chief and UNICEF chief, nutrition chief were talking earlier. That the multi-sectoral approach towards nutrition security is important, and the role of a district magistrate is so critical. That's why we wanted to bring forward this case study in front of all stakeholders and all our participants today. Thank you, sir. Thank you, Dr. Hiralal, sir. And we'll be in touch and we'll like to invite you in our other separate elaborate session on this. Thank you, sir.
Okay, thank you, thank you.
Dr. Manjri, if you can continue with your session and take the last questions.
Yes. So, yeah, thank you so much. That was very enlightening, this question is for you, Dr. Sujit. I just wanted to understand in brief, what are the specific nutrients that you are using which work as antioxidants and are in supporting immunity, essentially, which are antioxidants, the very powerful antioxidants in nutrition?
See, very briefly, I won't take much time. Just to finish it off, if you look at the immune system, to treat any immune systems, especially viruses always attacks the respiratory areas, and most of the death happens because of the poor lung function. So, primarily, I will give you a small mnemonic. It's called as A, B, C, M, and P, Q, Z. Just keep it in mind, A, B, C, M, and P, Q, Z. A for vitamin A, as we have already discussed it. Though you say that we can have vitamin A from the food, but unfortunately, most of the food, vitamin A, which is a proactive form, cannot be made to active most of the Indian generation, because the genetic disturbance is happening in that way. So we have to supplement vitamin A, especially in the childhood days, or through the oral base. Then comes vitamin B, because vitamin B decides whether a person gets a virus attack. And the second time also, if he wants to have if he is getting a virus attack, then that will be prevented by vitamin B, especially methylation cycle. So then comes the vitamin C. As you said already, vitamin C has an abundant role as an antiviral thing. You can give it orally around, not as a treating dose for scurvy. We give it around 350 milligrams. That doesn't work at all. At least orally around 3 to 4 grams you have to give it. As we say, it's actually through intravenously. If most of the people are here, if they're deciding that if we are going to give intravenous vitamin C for most of the corona cases in India, as a first line of treatment, not the last treatment, as a first line of treatment, then the immune system will be in a proper balanced way and the virus multiplication can be subsided. Then comes actually M and PQZ. M is nothing but melatonin. If I am not using a word called as it's a corona preventive thing, melatonin is one of the nutrient which doesn't have any side effects at all. Melatonin we give to cancer patients around 20 grams, so nothing to worry. 20 to 100 grams also can be given, but don't worry of that. Melatonin around 3 to 6 grams daily can make you to prevent from corona cases. Then comes N. N is nothing but N-acetylcysteine. It's a fantastic thing. P is a probiotic. Q is a quercetin, which usually we see in onion, and Z is nothing but zinc. So if you have these tools in us, A, B, C, and M, and P, Q, Z, this will help an entire country as well as the whole world to protect not only from corona, because corona may leave or come with us, but the thing is that we have to keep our body always fit and healthy. If a person is crossing beyond a BMI, you have to keep him inside the BMI. His visceral fat is increasing. Then what happens? Adipokines and lipokines start to arise, and then again the cytokines releases, and the imbalance happens. Not to be ready for another virus to keep only for the vaccination, because vaccination also doesn't help if the body is not healthy at all. So the primary agenda should be, the summit is nothing but the clear summit is nutrients in a proper healthy, optimal healthy way which will correct the entire population to a healthy world. Thank you.
Thank you. I'll add a D to that ABC.
Yeah. Fantastic.
So let's add the vitamin D also there.
Absolutely.
Is plenty in the sun, but sadly being indoors, we're not consuming enough of it.
Okay.
So now with that information, I'm shifting to Dr. Kriti. Dr. Kriti, we've spoken about the nutraceutical bit and you're into formulation, but can you, because with all the experience that you have, can you pinpoint something in our kitchens, because that's something the listener would want to know more about, something in our kitchens which has pharmaceutical activity. We know that turmeric is good, we know ginger is good, we know basil is good, we know that fenugreek, cinnamon. But when we're looking at the pharmaceutical aspect of a herb, could you list, let's say, the top 5 herbs found in my kitchen, which can be almost like the pharmacy in my kitchen?
Yes, so you already gave a very nice starting to that. So top is the curcumin. So again, talking about the phytoactive principle over here, so that needs to be of a very good quality, because these days the adulterations and the substandard qualities of ingredients which are coming actually hamper the phytoactive principle which is present in them. In order to give one example to this, I have seen a lot of kadhas and some tea blends which have come up in the market, which say that this is a curcumin latte, or you can just have a you can just mix it in any drink and you can have it. But it is very important that even though we have these ingredients in our kitchen, we must know the practical use of these ingredients. Like curcumin, as to start with, it is a highly lipophilic molecule. It is not having a very good bioavailability in our system when taken. So it's very important that the traditional systems which recommend curcumin to be taken in the form of curcumin milk, which is to be taken in the evening. It's very important to have that knowledge as well. So curcumin, being a lipophilic molecule, is never absorbed in water. So even if I actually read this article somewhere that the doctor these days are facing a lot of trouble because people are self-medicating with all these herbs in their kitchen. And there was a case where a doctor got a patient who had taken 3 to 4 tablespoons of curcumin with water daily, and he had all his eyes and nails yellow. So they suspected that it's jaundice, but later on when they got the examined him or took the history, they got to know that it was all about curcumin accumulation in the in the body. That's why it was turning like that. So this is very harmful also. So there needs to be a proper knowledge of the use of these ingredients. So curcumin, as for example, needs to be taken with an oily vehicle. Like for example, when we make food, we add it in our tadkas. So the whole concept of adding it to the tadkas, and it has to be added in the end, because it is highly sensitive to heat and pH. So that has to be taken care of. And coming to the next one, which is lycopene, it is found in tomatoes. So nature, plays very wisely. So what happens is that in intact tomatoes, lycopene is perfectly fine. But once you cut the tomatoes, the lycopene content starts getting degraded, going into the degradation form, because it is highly sensitive to light and temperature. So what happens is that you need to there is a lot of stress on consumption of or consumption ways of taking these fruits or vegetables, because the lycopene which naturally occurs in tomatoes is very less. So that's why people go to the formulations like capsules and tablets of lycopene, because it is very less. But overall, if you see, when you heat tomatoes or you consume tomato soup, thinking that you will get all the lycopene, it's actually getting degraded. Although you get vitamin C over there, but the lycopene content gets degraded. Then coming to the next one, which is ginger. So ginger is a very excellent herb, which seconds curcumin. So both are like rhizomes, but the thing is that ginger contains a lot of gingerols, and it is always better to consume dry ginger. I would actually, highlight this point, because the thing is that wet ginger, or the ginger which is, which is in the form of a wet form available in the markets, in the grocery stores, doesn't have a very good active of gingerol. The gingerol content starts degrading in the wet ginger, because what we call salt in our houses has much greater content of gingerol as compared to the wet ginger. So that salt can be added to your food, or say for example your tea mixes, a pinch of that, and can be consumed. Then the next one, as you said, is cinnamon. So cinnamon, apart from being a very good antioxidant, it does have a lot of anti-inflammatory as well as anti-cholesterol properties. So it actually prevents accumulation of cholesterol in the body, and does help with the cardiac disorders, or we say hyperlipidemia levels, which happen in case of cardiac patients and the people with cholesterol.
Sorry to interrupt, Ms. Kriti. I think it's very informative what you're telling. We also have with us, joined in a little early, Miss Rekha Sharma. She doesn't need introduction. Can we have a short comment from Rekha ma'am? She was the HOD of Nutrition Department of AIMS, former president of IDA, and I think a teacher to a lot of nutritionists all and dietitians across the country. So, ma'am, if you can unmute and give an expert comment on this topic before we conclude this session, ma'am, and we move on to the next session. We have Dr. Ravi, we have Dr. Gopalan, we have Miss Nim. I think everybody has joined us. Ma'am, please.
Good evening, Sudeep. It's nice seeing you. And it's
Thank
nice seeing so many people who are working so hard and being part of this team, which are doing so much innovations and helping in immunity. Immunity is the first defense that the body requires to get prevention from any virus, especially the COVID these days. So it is great hearing about the antioxidants and everything, but I just want to put in one point. Supplements is great, but we should not first ignore our healthy eating practices and exercise for immunity. You must have a good, adequately balanced diet. You must have adequate proteins in your diet. You must have adequate fresh vegetables and fruits and whole grains and good quantity and quality of oils. In other words, basic healthy eating practices and exercise every day. And then the supplement is over and above your normal requirement, because then it prevents you from the different diseases. As you're talking about the kitchen supplements or the ready-made, anything which is fresh is always good, but fresh will always have moisture into it, water content in it. So it is a little more dilute. So when you're talking of ginger, when talking of turmeric, turmeric has to be cooked. The curcumin is unavailable if you take the turmeric in the raw form. So you have to cook the turmeric for its availability. So kitchen is very good because that is where all the masalas and everything we already have in our kitchens. And my stress is a lot on a protein intake in your diet as well, because otherwise if you just take the supplements, vitamin C or zinc or your vitamin, I heard about vitamin E and vitamin A and vitamin D, great, but don't forget the basics of a normal healthy nutritious diet.
Thank you, ma'am. Over to you, Manji. And
Yeah. Thank you, Rekha ma'am. That was absolutely enlightening. But, adding to what ma'am was saying, one is, of course, as we were discussing about nutraceuticals, the concept of immunity, we've been speaking about it for many, many months now, but it's as simple as a healthy body. I mean, if you have a strong, healthy system, you will also have strong immunity. It's like any other organ system in the body. It's just that this system is comprised more of specific cells,
Yes.
and therefore it works in a slightly different manner. But the eventual underlining denominator is to have a strong, healthy system. And to add to what Rekha ma'am was saying, besides food and exercise, there are other many important contributors to having strong immunity. Your sleep,
Sanitation is a big one.
yeah, your circadian rhythm.
Pathogens should not go in, because if the pathogens go in, they break your immune system. So washing of hands itself has helped a lot in people getting immunity. So having proper hygiene and having a proper sanitation is equally important is the diet. So it's a combination of all.
Yeah, yeah. And last bit that people forget is sleep. They forget that it's important to rest yourself to heal.
Yes, sleep.
So those good circadian rhythms, that little thing that we were taught in school of early to bed and early to rise, was taught because it stays with us all our lives. So if we get back to basics, it's really technical, but not so technical for the common man. If he's able to put his kitchen in place, his movement in place, his sleep in place, his actions, if you're allowing the parasympathetic nervous system to dominate you all the time and you're always in an overdrive, the poor immune system is also in an overdrive. So calm down.
Basically a good lifestyle.
Yes.
You should eat well, you should sleep well, you should do some stress management, you should have proper hygiene, and you should take these supplements over and down to protect yourself.
Absolutely.
Thank you. Sorry for cutting it. It is in fact getting on to a very hot session and very interesting. In fact, the alphabetical chronology given by Dr. Sujit. I'll try to learn that A B C D P Q Z, and that is something big takeaway. And what Kriti was talking about, the kitchen related and
Yes.
the ingredients and how they are you can use it best for nutrition and
It's
expert
very important, yeah.
Rekha ma'am, and of course an excellent moderation by Manjri as always. We are doing I think fifth or sixth session with Manjri, and all of the sessions are very much liked and appreciated all over by all our viewers on Facebook Live, on YouTube Live, and a lot of restaurants which includes nutritionists, dietitians, students, and other stakeholders of nutrition who have joined together today on Zoom. So I'd quickly like to thank you so much again, everyone. Sorry for interrupting in between. We have to do that in between because we have to keep moving on to our next session. It's a very interesting session. I'd like to request our jury members are also joining. Welcome Sony and welcome all others. Rekha ma'am is already there. We will have a very interesting announcement of the awards, the Immunity Champion of India awards after this session. This session is on Ayush. I'll hand it over to Shankar sir and Manjari to please take forward this session.
Shankar sir.
Ankit, if you can give the intro.
I'd like Ankit to first introduce the speakers for this session. Ankit?
Yes, sir, I'm here introducing the next session for the day, which is Ayurveda, Yoga, Naturopathy, linking ancient wisdom to modern science. For this session, we have with us Dr. Ravi Badri, Ayurveda expert, Kedar Ayurvedic Center. Dr. Ravi Badri is a super specialist who is working toward reaching special herbs for curing chronic illness, treats all kinds of chronic disease amidst this scenario of epidemiological transmission. Then we have with us Dr. Saurabh Sharma, Medical Superintendent, Ayurveda Specialist at Maharishi Ayurveda Hospital. Dr. Saurabh Sharma, DMS and PG in Hospital Management from Symbiosis, Pune. A competent Vaidya with extensive knowledge of Ayurvedic medicine. He has also given Ayurvedic consultation in Maharishi Ayurveda Health Center, Thailand. And we have with us Ms. Nim Limau, yoga consultant and therapist, experienced and passionate yoga teacher with over 5+ years of professional experience in designing and leading and yoga therapy classes, holistic well-being through teaching and consultation. Last but not the least, we have with us Dr. Dinesh Gopalan, freelance corporate trainer and consultant in finance, management, leadership. Dr. Dinesh has done his MBA from IIM Ahmedabad 1987, specializing in finance. He was Yoga Shiromani Yoga teacher qualification from Sivananda Ashram in 2013, Yoga Acharya MSc in Yoga from SBYAS University of Bangalore in 2018, conducted various seminars on health and wellness, the Hatha Yoga practitioner. So this session, as we are doing this Ayurveda, discussing about the bringing ancient wisdom to the modern science. Yesterday we lost Dr. P.R. Krishna Kumar, who was the Padma Shri and is known for his contribution in the field of Ayurveda. This session is our tribute to Dr. P.R. Krishna Kumar. I would like to speak briefly about him, and from here, Mr. Shankar can take over. Dr. P.R. Krishna Kumar was an Indian Ayurvedic physician and the founder of the AVP Research Foundation, a non-profit research organization promoting research in the Indian medicine system of Ayurveda, and managing director of the Ayurveda Pharmacy, Coimbatore. He was the chancellor of the Avinashilingam University, the chairman of Confederation of Ayurvedic Renaissance, Kerala, a research center involved in efforts to standardize the Ayurvedic medicine, and was a recipient of an honorary degree from the Coimbatore University. The government of India awarded him the 4th highest civilian honor of the Padma Shri in 2009 for his contribution to medicine. From this, I'll hand it over to Mr. Shankar to take it from here.
A couple of things unknown about Dr. Krishna Kumar, that he was a very avid reader and he had multiple knowledge in multiple areas, and he was well respected in Coimbatore. Not only Coimbatore, people from all over the world came to him. I think he was not just an Ayurveda specialist, but he had a lot of knowledge about, the whole world around yoga, then philosophy, religion, music, and all this, he's a multi-talented man. It's very unfortunate that we lost him at age of 69 yesterday, and probably he had a lot more to contribute. We'll go on to the session now, Ankit.
Please.
Yeah. Manjari, you want to shoot out the question, or you want me to shoot out the question?
No, it's all your honor, Shankar sir. Please go ahead.
Okay. I'll come to Dr. That we have been saying that Ayurveda is the focus is always on immunity and Ayurveda. Now we have a lot of these things coming in saying that Ayurveda builds up the immunity. Ayurveda is good during COVID times. Ayurveda is this. Ayurveda. Sometimes some people have a feeling that it is an oversell in the sense that you're talking about things which without much sort of evidence. What type of evidence is there to show that Ayurveda is extremely relevant in the time of COVID?
Your question is to?
My question is to Dr. Ravi.
Dr. Ravi, I think he dropped. He's dropped because of his connection. Can we point this question to Dr. Saurabh? Dr. Saurabh, you are there?
Yeah, Dr. Saurabh can take it up. Yes.
Dr. Saurabh, please.
Hello, namaste.
Namaste.
So that's a very good question, sir. But somehow I do agree with your point. But what I personally believe is this, okay, it's kind of a blessing in disguise because as of now, what we were doing, I'm sorry to say this, I'm including myself also, we were running in this cutthroat competition and everything, running in this cutting edge things, and we somehow lost the first aim of Ayurveda, which is Swastha se Swasth Raksha. So I think somehow this scenario has brought us back to the nature, as Ms. Manjari was saying, let's get back to nature. And these herbs which we are speaking about, I mean, the combination of herbs which we are speaking, let's say giloy, let's say ashwagandha, let's say other spices like, salt, black pepper and pipali and other. So if we speak about the research part, so I'm really happy to say that there is plenty and plenty of research available in all the national journals, international journals, NCBI and everywhere, which proves not only the antioxidant properties, apart from that, immune booster properties and other properties. So I believe that this combination of herbs, because in Ayurveda, we always say sanskaro hi gunantar dhanam. So when you combine the herbs, they basically increases the, the strength and the efficacy also. So I think that way, it's a good thing that we have something to do. And I think it's a blessing actually, sir, because this is not something, as we all know, I mean, we from India, we understand very well that these are all of our kitchen spices and everything, which we, I think, forgot or lost, or, the intellect, we call it in Ayurveda, pragya parad, which is called as a mistaken intellect. So we knew all these things, but we somehow forgot, or we didn't put that intention. So with this pandemic situation, we at least came back to the basics, and this combination of, let's say, if it is the Ayush Quat or the other herbs, the combinations, they definitely improve the immunity for sure, sir. So at least we always say, as I said, prevention is better than cure. So in that part, it gives a big boost to us.
I agree with one point that you say that, this wisdom has come from ancient, rishis, munis. They have come from one generation to another, and it has been passed on. But the conflict comes when you see Westerners say that, there is actually no proof, in the sense that the way that they do research. I'm not blaming them, I'm not blaming you. But how do you convince this particular thing that, for example, taking Chyawanprash is good, or taking this sort of medicine at this point in time? You also have a major problem in the sense that some of the Ayurveda experts say you should take XY type of herbs only during XY type month or such and such period. Is all that true? And is there any literature behind that, or the way you do scientific research? How is it done?
Yes, that's a very, very good one. I really appreciate. Yeah, that's true. It is clearly mentioned in Ayurveda. Let's say, for example, if we speak about just Lipla only, or we speak about Haritaki only. So there are definitely, in Ayurveda, we call it as Anupana also, like with which it has to be taken. And according to Ayurveda, and this is absolutely in the text also, sir, that it is mentioned that, let's say, if we speak about the doshas, I mean, which are basic energy principles, and don't even speak about the dosha. Let's speak about simple basic 5 elements, which I don't think needs to be, given any proof or so. But if we speak about that thing also, so Ayurveda is basically about the balance. So when there is any kind of imbalance, then you have diseases. So exactly what you said, the same point I would like to repeat the same. that there is, let's say, for example, sir, just very common thing. Let's don't even speak about Ayurveda. We know very well that, I mean, we have great nutritionists and very good panel here. Simply speaking that, okay, it's good not to have major meals in the night because your digestion is weak or so, right? So the same way, sir, Ayurveda has also said about the doshas, about the ritus, about the seasons, and this is absolutely mentioned in the Charak Samhita, Sushru Samhita, and Bhagavad Samhita about the timings, about the ritus like the seasons, and which to take, what combinations. As I said, sanskaro hi gunantar dhanam. So there are certain things which are basically opposite foods, like we call it Viruddhahar. So these combinations which are there in the text, definitely, and somehow, thank you very much, sir. I would again say that simply speaking also, in these, if these combinations, if I compare with the modern science also, then definitely you can see these combinations create imbalances in the body. So that's very practical. And secondly, what you said about sir, the researches, let me not take a lot of stuff, just take haldi, or let's say curcumin. I should not say that how many researches are done, because I think more than us Westerners have done the researches in that. And the same way they are doing with ashwagandha, with giloy, because I do travel. I mean, almost everywhere in the Europe, I have people there, lectures and consultations. So this is a very common question. And believe me, sir, they give me, and you will not believe me, sir, our Charak Samhita, I mean, sometimes they tell me the shlokas. Okay, Dr. Saurabh, in Sutlastan on the second chapter, this is the fourth phrase which is written. Can you please guide us how to go with this? I mean, the point of this, sir, the way they have been scientifically proving, I really feel honored to be an Indian and say that, okay, what Charak Samhita said, what Sushruta Samhita said, what Bhagavad Samhita, they are absolutely right. And one more thing I would like to mention here, sir. We have Madhav Nidan, an ancient book, in which the diagnostic tools are mentioned. Sir, I'm practicing for last 12 years as a Ayurveda consultant around the globe. And believe me, sir, believe me, the diagnosis and the prognosis which is mentioned in those books 5,000 years back, believe me, if you see a patient, exactly the same thing comes up. Exactly the same thing.
Yeah, that's
Although I definitely use the modern diagnostic tools also along with the Nadi Vigyan, but exactly the same. And I'm really like surprised what exactly picture comes. So, sir, that's true actually.
I'll ask you a very tricky question, Dr. Saurav, is that you have mentioned about balance. So if there is a particular person who is maintaining a perfect balance the way that you say in Ayurveda, will he or she get COVID?
Sir, okay, very good question. Yes. Let me tell you why. Yes, maybe. Why? Because to get any disease, there are two, three aspects. First is asamendriya sanyog. It means when the coordination of your indriya, it means the senses and the mind and the soul is not proper. One thing. Second reason could be pragya parag, mistaken intellect. I knew that I should not take ice cream in the winters and I'm taking it. And third is the kal. Kal means time. So in Ayurveda, this present scenario is called as Jan Padodvans. Now, Jan Padodvans is when the Vayu, Jal, Desh, and Kal all are polluted or all have infections. So this present COVID situation, I believe this is a part of Jan Padodvans. So even though I am balancing everything, as I said, Swasthas is Swasthya Lakshanam, then also the probability of getting not only this or maybe other kind of infection is definitely possible, because it's not just my balance, it's about the balance of nature also. So this is Jan Padodvans, sir, and Jan Padodvans is causing this kind of issues.
Yeah, before I move on to the next speaker, just one small thing that I would like to ask you is that we had ancient rishis passing on the wisdom to us, and now we have Westerners who are doing the research for us. Are we doing any research in the sense? Are we doing anything about it?
Yes, sir. Definitely, we are doing a lot of tough stuff. I mean, we are, sir. I mean, I'm from Harshi Ayurveda, and our team now, 12 years, I know them, Our team, like, let's say what you said about Chyawanprash, we have a very great antioxidant, which we call as Maharishi Amrit Kalash. Our team, like 2 doctors, full-fledged doctors, and a team of some more staff is working in AIMS, All India Institute of Medical Sciences, doing researches. Definitely it takes a little bit of time. So this is one thing which I know. And fortunately, and by the grace of God, a lot of researches, I will not say thousands, but a lot of researches we have done on our products. And the same way on the active ingredients, as the other doctor said also, in KGMC it is going on, in international universities also we are doing, and here also we are doing. So definitely, sir, we are doing a lot of work. And even though now recently, you must be knowing, we have opened a All India Institute of Ayurveda also. So they are also doing a lot of researches. So small institutes, so CCIM, everywhere researches are going on, and there are a lot of papers which have been published to prove the efficacy of the herbs.
Maharshi Ayurveda has been doing a really splendid job. I think that is excellent. I'll move on to Mr. Gopalan, Mr. Dinesh. As a corporate trainer during these COVID times, what actually can you describe your role before COVID time and after COVID time, especially since people have been going through stress, people have been losing their jobs, there are a lot of things, multiple things happening, and it is a trainer who is actually trying to pull them back to normal life. So what have you got to say about this?
Hello, everyone. Good evening. Okay, what do I have to say? See, I am basically training a lot of IT folks and mid-career folks in Bangalore, both in finance, and I do take some seminars on wellness. So the problem, like Dr. Saurabh pointed out, is not just the COVID virus entering or something, it is the overall lifestyle that is also at fault. I mean, right from sleep patterns to extra stress to people always being exposed to radiation from various screens, not getting fresh air, fresh breeze, ignoring their diet, ignoring lifestyle rules, simple lifestyle rules. Sleep is a problem because they get into, night conf calls. And, I always get reminded of, one of the rules of good health. It says that you should have, your mind should be completely shant and your body should be active. Unfortunately, the IT professional of Bangalore is exactly reverse. His mind is all the time overactive and overheated, and his body is completely shant. So as a result, what is happening is prana is completely blocked. And it is very, very clear that, yoga theory says that when the prana gets blocked, all kinds of diseases results. You feel the disease in the Annamaya Kosha level, but the Pranamaya Kosha rules the Annamaya Kosha. And then so on and up, you go to Manomaya Kosha, Vijnanamaya Kosha. Let's not even get there. Just the Pranamaya Kosha itself is completely blocked by modern lifestyles. And, we can have all the antioxidants you want. I mean, you sit, you don't move, you block all your prana. Having Chavanprash is not going to help. First, get your proper sleep, then get, simple movement. Another rule for prana movement is, and it's not just Ayurveda or yoga, even ancient Chinese herbal medicine, the Taoist philosophy. It says that, you have to, it's like the hinges on a door. Hinges on a door will rust if the door is not keeping on opening and shutting. Your body will completely stagnate, your energy will stagnate if you don't keep on moving. And we are talking of simple, gentle movements here. Even that is not there. So where do you want me to start? You asked me about my students and my, people.
No, I want to ask you, you are working in Bangalore and there are a lot of people who are working from home now. How has that affected the lifestyle as such? Now, you said about movement. Earlier itself, there were no movement. Now, after working from home, the movement has still come down. So how do you as a corporate trainer try to do this?
I agree with you, sir. And it's not just the movement coming down. It is complete panic in the mind. In my own view, this whole COVID thing is absolutely overstated, unnecessarily, overblown. And people are getting more and unnecessarily panicking. Look at the statistics. I mean, all our doctors here, I don't have to repeat. We need not panic so much. And the point is, it is very, very clear that in case the mind starts panicking, in case there is overall negativity all around, immunity is again going to drop. So it's not COVID I fear so much. It is I fear more the side effects of people trying to run away from COVID and the mental state thereof and the complete lack of energy, negativity, and it is going to affect their entire health. I fear that more than the actual COVID. This effect of this is going to last now for months and months.
So you do agree that there is a lot of COVID panic rather than pandemic?
Absolutely, sir. I completely am with you.
Yeah. So how, as a trainer, how do you actually drive the panic out? There are doctors who can drive the pandemic out, but how do you drive the panic out?
There is no exact way except to go back to the basics. And I think I have been listening at least for the last half an hour. Many people have talked about it. Go back to the basics and say, first, get your sleep right. I mean, get your sleep cycles right. Then get your overall diet rules right. Forget about specific diet. You know, Dr. Saurabh, I think, also mentioned, and eat light at night. You know, go with the cycle, nature cycle. You know, your digestive fire, Agni, is at its maximum during the midday. So do that, follow that. Keep your mind calm. See, we have to go back to the basics. And when it comes to specific prescriptions for these IT folks, we get on to, okay, when you are actually working on your desk, why don't you get up every half an hour or 1 hour, take a walk, keep your prana moving, don't forget to breathe. By the way, I don't know, you know, being a yoga practitioner, I can tell you that most people today have even forgotten how to breathe. Breathing has to be pushed by the diaphragm. It has to be deep breathing. What is called complete yogic breathing actually starts with the diaphragm. When the breath goes in, the stomach has to puff out. A lot of people, when they take the in breath, the stomach goes in, which is straight away a wrong way to do things. Deep breathing, normal, you see how a child breathes. The stomach goes out and in, and it is okay. One more thing, total relaxation response. Yoga demands that. Yoga actually says, and same with Chinese traditional wisdom, the mind is relaxed, the body is relaxed, and when the overall system is relaxed, that is when you are healthy, both physically, mentally, emotionally. So we have to tell them not to take stress. You ask me, what do you do? Okay, give them the overall basics, but at the same time, say simple things like, look, how to integrate these things into your daily lifestyle. Okay, at least have a 20-minute stretching routine. Why call it yoga? Even the stretching that you do before you play badminton, or things like that. Stretching is more important. Flexibility is key. Then only comes strength and aerobics. So tell them, okay, at least do that much. Tell them things like, look, I mean, now of course, because of COVID, people are sitting at home, so you tell them to go out for a walk. But otherwise, I used to tell them, look, when you're going back home and you're going by the company cab, why don't you get down one stop earlier, 1 kilometer earlier, and just walk? At least you have that movement. Other thing problem, sir, with Bangalore is that with these glass buildings, and Bangalore is full of glass buildings, people shut themselves inside. They have unnatural artificial air. They have unnatural artificial climate. Nobody knows when the sun is rising, when the sun is setting. Nobody knows if there is rain outside. Even Khalil Gibran, I think, very poetically has said, I mean, go out there, get the sun, the wind, the rain on your skin, and be out there. Our bodies are meant to be with nature. So you put a very deadly one here. You said, Bangalore, what is it? There are 100 things about Bangalore lifestyle and the IT lifestyle that completely militates against what Ayurveda, yoga, Chinese traditional wisdom, or for that matter, even a Red Indian, grown up in, the Red Indian or ancient American wisdom of 400 years, they are all absolutely common, some of these wisdoms. And unfortunately, we are going against it. So it's a fight.
I will now go to Nim, carrying further your thing about Bangalore, the stress. Nim, you are into yoga, and I don't know whether you have seen a recent study which really said anxiety among Indians is at record level, with a recent survey showing that 1 in every 4 individual is so stressed that he or she actually needs medical intervention. In such a case, how does yoga help out?
Yes, namaste everyone. Yes, definitely.
Namaskar.
As a yoga consultant here in Sikkim, I'm from Sikkim, and we have a limited hospital here. It's a small state, and with the pandemic COVID-19, with the patients, they have developed that fear that if they go to hospital, they might come in contact with the patients or COVID patients, and that fear and anxiety about not knowing the future, because we don't have a vaccine that has come out already, or we don't have any idea about when the vaccine will be available for the public here. So I see a lot of clients, mostly, and also one of the reasons is due to, again, we were talking about the mobility before, and then, am I audible?
Yes, you're audible.
Yes, okay. Many people who visit and who take consultation from me, they have this depression, they are more inclined towards depression or anxiety because of not knowing the future, or maybe the restriction of mobility or freedom of movement. Because here in our state, we still have the whole lockdown situation going around. So,
well, can you tell the viewers actually where you're from? Actually, you're saying in my state, but which state?
so I'd mentioned I'm from Sikkim. I've
Sikkim,
mentioned
okay.
before.
Okay, I
I'm
didn't
Sikkim
hear you. We didn't
Bangkok,
hear you
yes.
at that time. Sorry. I'm sorry about it. Yes.
Okay, yes.
Yeah. So
Yes.
I'd like to ask
So,
you one question, which I asked Mr. Gopalan also, which is more dangerous? Is it actually the pandemic or the panic?
I would say a panic. I would still, I'd go with Dinesh, that it would be panic because it has created a huge issue between people. And then this panic, this panic would again lead to, we all know about the psychoneuroimmunology, right? So how this panic and the anxiety and depression would inversely and also directly affect our immune system. So I have seen myself with my clients, ongoing clients, and I have new clients that have come up, especially during this pandemic. There is a huge rush of people coming on, mainly because of the problem related to stress. Like I mentioned, we still have a lockdown situation going on here, despite we don't have that huge number of people affected with COVID-19 in comparison with the rest of the states or the rest of the country or other countries as well. But that has created the restricted movement and the freedom of movement has created a lot of stress, and also the panic, the anxiety of not knowing how long we'd have to stay indoors like this also has created a lot of anxiety in people. So I think I would go with panic here.
That's a good work in Sikkim, yes. Saurav will come back to you regarding a question about what exactly is there in Ayurveda to fight. Are you there, Saurav?
Yeah, Shankar sir, can I take the last question? Because
yes, please take. Go ahead.
So my question to Mr. Gopalan and Nim. Mr. Gopalan, are you there? Sir, if you can unmute. Huh? If you can unmute, yeah.
Yes, I'm here.
So to Dr. Pandav, our patron, he pointed out about today being our Prime Minister's birthday, 70th birthday. And our Prime Minister, Mr. Modi, has been very instrumental in promoting International Yoga Day, other than giving emphasis to overall Ayush holistic approach and bringing back the attention back to Ayush in India. What Dr. Saurabh said, that how the Ayush part, Ayurveda part globally and in Europe, it has gone to the next level, and India was missing the bandwagon. Now with this PM has come and put the attention back. So my question to you is particularly with respect to Bangalore and type of clientele you see. There's been so much of hue and cry and noise about this International Yoga Day, word over things happening. Do you think it's have any impact on this new cosmopolitan crowd, particularly the IT professionals across Bangalore and multiple cities across the country? What is the impact, and have they adapted to actually practicing yoga or similar sort of practices?
Well, thank you, Doctor. So I would like to answer that in two levels. At the first level, the impact is on the awareness, which definitely has gone up. And, because of the Prime Minister's initiative and because of the push, it's not just International Yoga Day, there's a lot of push and there's a lot of interest on traditional Indian wisdom, including Ayurveda and, related things. And more people are more and more aware. And I don't know if people are aware, the people who are watching here, but I have grown up in Bombay and I settled down in Bangalore in the last 20 years. I believe Bangalore is the organic capital of India. I mean, there is a huge level of awareness and actual people actually buying more into organic, stuff and getting into more natural diets and stuff like that. It all starts with the awareness. So the first is the awareness, which has definitely gone up. Now you specifically asked, okay, what are people adopting more to yoga? And I don't know. I think the lifestyle is so difficult out here, but we will not give up hope. The awareness is the first thing. It has to enter the mind. It has to, then they have to get convinced that that is already happened. A lot of diet is little easier to shift. One, because it's something that is affordable in Bangalore. People do earn that much. And two, it is something that, okay, it doesn't require extra effort to cook an organic carrot compared to a regular carrot. But when it comes to exercise and yoga, unfortunately, even if I am a yoga practitioner and I know all the theory in the world, I have to put in that half an hour or 1 hour every day, and I have to practice diligently. And if I don't practice for 3 or 4 days, the effect is visible to me also. So, and we are all human beings, right? We get sidetracked by life. So in spite of being convinced, if I miss my practice, I mean, so that's the fight. So, but more and more awareness is happening, sir, as you pointed out, because of this.
That's why Dr. Panda says that Mr. Modi is the public health champion of the world.
It has to start with awareness. There's no choice.
He's been able to create that impact due to awareness.
Yes.
My question out of curiosity before we end this section with Shankar sir's concluding remark and move on to our award program. To Nim is that I've been to Northeast few times and you are from Northeast, and what do you see the practice of yoga and all these adoptions happening in Northeastern population? Because somehow physiologically and in many ways the Northeast population is traditionally not doing yoga and these traditional medicines.
Yes, definitely, Doctor. Thank you for the question. Yes, the celebration of starting of International Yoga Day and with the Honorable Prime Minister promoting yoga along with other alternative medicine, it has definitely seen a lot of awareness in Northeast as well. Previously, as I recollect, yoga was mostly for weight loss. It was one of the practice along with Zumba, it was practice. However, the holistic approach and the other approach, there is a lot of awareness that has developed over the time. And as we were talking about the awareness, as I give consultation in a lot of pharmaceutical companies as well. So people here in Sikkim, I go to few where I give corporate sessions and corporate consultation along with the therapist for there are plenty of pharmaceutical companies here. So the awareness, they reaching out to us for yoga and yoga therapy. And also if I see in the market or with the public here, the awareness, yes, it has improved a lot. And it has shifted to a great extent towards people from Northeast becoming more aware towards yoga.
Thank you.
Also alternative medicine.
Shankar sir, your concluding remarks for this session.
It was really a wonderful session as usual. Throwing a lot of light regarding yoga and Ayurveda, and as what Dr. Saurav said. Yes, Charan has given us a lot of from the past. What we need is actually probably they didn't give us a working manual on how exactly this works. Probably that is where our work comes in. But we are people like Dr. Saurav and Maharshi Ayurveda and others are doing considerable research in trying to get these things on board and see how exactly it works. Yoga also plays a major role in this pandemic times. And as what Dr. Gopalan said, from the sleepless city of Bangalore, covered with glass and wrapped in their own lifestyle, I think it is extremely difficult for them. I sometimes wonder whether there is an awareness or a fad for all these things, but then Bangaloreans are always Bangaloreans. They go to an extreme, things, and you have to live in for. I really appreciate Dr. Kopan that he's lived there for 20 years. It's a city that actually has changed over so many years and keeps changing every day. So we have a lot of things to learn from this particular session, and so we have that we have gained from this session. Thank you, Dr. Sir. Thank you, Dr. Gopal. Thank you, Nim. I think this was an excellent session which threw light on ancient wisdom, not only in modern times, but ancient wisdom in COVID times. I think Ayurveda and yoga has this speciality of looking at a particular problem in a multi-dimensional way. and not a single track like what others are doing. I think once we address this issue in multi-dimensional way, taking all aspects of a human being as a human being, then probably we can get this solution across. Thank you very much, all of you. Namaskar. I hand it over back to you, Sudeep, and to Ankit.
Thank you.
Ankit, thank you everyone. Thank you. Ankit, can we start with the...
Now we would like to move on to our next part of our eSummit, that is Immuno Champions of India Award. For that, our host for the day is Ms. Shagun Singhal. I'll start with her formal introduction, and from there she can take it over. Shagun is a motivational speaker, columnist, and educationist. Shagun's expertise lies in leadership, peak human performance, mental strength, emotional intelligence, building employee-employer relationships, and scaling businesses, improving children's psyche, and mindful parenting. Her recent independent show online during COVID-19 phase since Feb 2020 reached 48,000 live views as a speaker. She has served as a brand strategist and communication consultant with Z News, News 24, E24, Primary News, and entertainment broadcasters. Shagun has also showed her talent in acting, modeling, folk dancing, and air rifle shooting. Over to you, Shagun, to take this ceremony.
Thank you, Ankit. Thank you so much. Namaskar. A very hearty, warm welcome to the awards section of the eSummit. Thank you all. With due respect, Mr. R. Shankar, Dr. Swadeep Srivastav, Heal Foundation. What a fantastic show this has been, and how knowledgeable, what wonderful notes we all have been making, and the attendees have been growing. And now we're coming to a very exciting part of the show designed by the partners as well as the organizers. During COVID-19, nutrition is of supreme importance in supporting the human and the immune system. Healthy eating patterns actually define the functioning of the body, and unhealthy eating patterns actually result in chronic diseases, is the nutshell summing up after all the expertise and the advice that we've got from health experts across the country. Nutrition really has a very staunch role in actually revival of patients after COVID. Research has proved this. You know, just stepping outside the ICU and free from COVID did not get you back to normal. It is medical nutrition which is important to actually let the person stand tall and come back to original. World Health Organization, the most prestigious health body in the country, has harped and actually released a mandate and a guideline during the pandemic, which clearly states that eat home cooked food, do not eat outside, importance of eating healthy fresh food, do not consume unprocessed food, water intake should be more, and moderation of fat and oil. And that defines the significance of the topic chosen today by the organizers, that how significant nutrition and immunity will be in coming times ahead. Mr. Shankar, Mr. Srivastav, as he knows that I'm a motivational speaker, and my work during the COVID phase, I firmly believe in the fact, and I am assuming that most of the health experts here would agree, that if you want a strong immune system, you need to laugh out aloud. You need to view life positively. And also in everyday life, you need to take steps in a very calm way so that your immune system rises, along with medical supplements that you take and the other herbal supplements too. Heal Foundation, along with the other partners on board, and ICCIDD, and also the media partners, Express Healthcare, bring to you today Immunity Champion of India Awards. You know, the jury comprises of such senior stalwarts across the country. And let me bring to you the jury here. We have Mr. Pavan Kumar Agarwal, who's the IAS Special Secretary Logistics, and he's the in the Ministry of Commerce, Government of India. We can see his credentials right in here. And we move on to Dr. Rekha Sharma. And we have Dr. Rekha Sharma, who is the former president, IDA, former HOD, Department of Dietetics, AIMS, New Delhi. She has more than 30 years of experience in the field of nutrition and dietetics, as we've seen beginning from her career in Boston Hospital for Women, USA, and then moving on to become the chief dietetics at AIMS. She has written about 10 books on diet management, and she has all these achievements to her kitty. Moving on, we have Professor Gechi K.G. Suresh, Dean School of Modern Media, UPES, Dehradun, plus he is also the former DG of Indian Institute of Mass Communication.
Sorry
He's
to
New
interrupt you, Sagun. He has also now been promoted to as the Vice Chancellor of Makan Lal Chaturvedi National University of Journalism and Communication, Bhopal, just last week. He's just taking charge yesterday there. Just for the information. Thank you.
Thank you for that update. We have that recent update right in here. Thank you, Dr. Sardeep Srivastav, for that. And he's in New Delhi based, like we see, he's a senior journalist, columnist in communication strategies. Before joining, he has served as a Director General, as we have mentioned, and he is also senior consulting editor with DD News, India's public news broadcaster, editorial consultant with Asia Net News Network, and those are quite a few achievements to his credit. And now we move on to Dr. Chandrakant S. Pandav, a highly achieved man. He's former head of department, community medicine, AIMS. He is the founder, member, and regional coordinator for South Asia of International Council for Control of Iodine Deficiency Disorders since 1985. Dr. Pandav was former president of Indian Association of Preventive and Social Medicine for the year 2007 and 8. He's been working in the areas of iodine deficiency disorder, micronutrients, health system, research, health economics, and human right issues. Moving on, we now move on to a very, very dynamic person, Mr. R. Shankar. It's been such a pleasure hearing you, sir. President, HEAL Foundation. He has more than 30 years of experience in the field of journalism and has also organized about 200 health writers workshops and 7 national health writers and editors conventions in past 5 years. He was formerly associated with New Indian Express as resident editor South and later took on to become the editor of MSN.com. Currently, he's the chairperson of organizing committee of HEAL Foundation that we all know, HEAL Writers, Editors Convention, and consultant with many media houses. Next, we have on board a very, very dear friend who I've worked with in the past, Ms. Soni Sangwan. She's a senior journalist and a health writer, media professional with extensive print and television experience, have worked with Hindustan Times for 9 years in various capacities, including team leader roles, have been a part of launch team of 2 new products in the Indian media market, news channels CNN, IBN, and tabloid Metro Now. That's quite a level of achievement to a kitty. And we now move on to Mrs. Deepti Gulati. She's the head of programs at Global Alliance for Improved Nutrition, New Delhi, head of programs at Gain India with a demonstrated history of working in the development sector, skilled in nutrition and public health, food security, food fortification, food technology, and program evaluation. That's quite a power-packed jury like you all saw. And now we're coming to actually the creme of the awards, which is very, very important. Welcome to the Immunity Champions of India Awards, ladies and gentlemen. Our audience is sticking around. There's not been a single member drop since this program started. And I know you all are waiting for the excellence that we're going to celebrate today. We're going to be celebrating startups, nutrition champions of the year, diet modules, immunity marketeers of the year, best CSR activities of the year, and many more to come. There are 2 sections. We're going to be dividing the awards into the organizational section and the individual section. And these awards, why are they happening? That's the most important question, because this is to boost the morale of all the players in the segment of nutrition as well as immunity, who have worked extremely hard ever since this pandemic hit the country to improve the immunity of people around and combating this pandemic. And now, after the eSummit, that successful eSummit that we've had, we now move on to our champions, the winners of the evening. Moving on to the organizational category. All right there, I think we all geared to our seats, and this is going to be a bit of a surprise. The award for Food and Technology Award goes to Aspertica Biotech Private Limited. Daily drops comprising of 15 herbs. You have beam roti, immunity booster chapati, Indian flatbread comprising of all the active ingredients from herbs. You know what? These two products were developed extensively to combat the pandemic through indigenous technology. This immunity booster, the chapatis were actually supplied to the migrant workers during the pandemic phase, and they have reached out to about 5,000 individuals. Congratulations, Aspertica Biotech Private Limited. Moving on to the next set of awards, which is the Immunity Booster of the Year. All right, so we're moving on to an award which is backed by three companies who have actually won this award. We'll move to the first company in no chronological order, which is Converge Biotech Private Limited. All right, so Converge Biotech Private Limited was the first company in India to promote aggressively the use and benefits of high dose of vitamin C in the treatment protocols of COVID-19 and ARDS for better recovery. It has actually the USPs of improving the recovery in COVID-19 and making it one of the most cost-effective treatments during coronavirus. Congratulations, Converge Biotech. That is some achievement for Immunity Booster of the Year. I think we can all have a hand of applause also, since the award ceremony is more about acknowledging the companies that we have on board. The second winner for Immunity Booster of the Year goes to Maharishi Ayurveda Products. It doesn't come as a surprise. The role of Rasayan in restoring holistic health and fighting the infections borne by the epidemic is predominant. Maharishi Amrit Kalash, so it's called, is well researched by 80 researchers across the world, and it has hit 50 countries in the last 35 years. They have also organized webinars with Ayush Ministry with about 20 countries. A whole lot of credits to their list. Congratulations, Maharishi Ayurveda. This truly belongs to you. Immunity Booster of the Year. And the third company, which definitely stands tall for the Immunity Booster Award, is Kepler Healthcare Private Limited. Kepler Healthcare Private Limited developed Mocktail Immune for boosting doctors' immunity. While the doctors were taking care of everybody around, they were taking care of the doctors. Because of their appreciation and recommendation, they actually launched the Mocktail Immune commercially. Essential, it's made out of herbal extracts, multi-herb formula. It's a blend of 14 herbal extracts. Each herb is specially designed and extracted to make human immunity more impactful and more successful. Over 1 lakh doctors and chemists have personally used this product. And in just about 3 months of the launch, 4 lakh people have been immunized with Mocktail Immune. That is the power of the product. Congratulations, Kepler Healthcare Private Limited. You're a real achiever in this category. Moving on to the third award, which is for the Immunity Startup Award. Would you like to have any guesses? Okay, since we are all on mute, I think Dr. Srivastav, I'll proceed with the event, and the award for the Immunity Startup Award goes to Malipatra Nutraceutical Private Limited. Well, the company has designed the novel process and product for immunity boosting comprising cordyceps in the form of capsules, fruiting body infusions, and fruiting body powder with the support of what you see on your screen. Congratulations, Malipatra Nutraceutical Private Limited. That's quite an achievement. Moving on to the next award, which is our award for the Corporate Social Responsibility CSR Initiative of the Year. And I can see everybody glued to their screens now. And the award goes to Steadfast MediShield Private Limited. Yes, taken a step forward to support Institute of Kidney Diseases and Researches, Ahmedabad, and committed rupees 15 lakhs for setting up a COVID-19 testing lab for the deadly virus. Combating it and killing it is such an amazing step. Congratulations, Steadfast MediShield Private Limited. That actually calls for a lot of celebration. Moving on to the next award. Now we have Innovation in Food Supplementation. Any guesses right there? I think we all know it all. It again goes to Steadfast MediShield Private Limited. Well, this is a division which launched the Herb Fizz. Yes, I can see all the clapping there, and I think we all are celebrating these awards. It's a blend of 9 neo-ancient herbs. Like you all can see on your screens, you have spinach, aloe vera extract, wheatgrass, and many more, which are actually known to boost your immunity, improving digestion and detoxing the toxins of your body. Congratulations, Steadfast MediShield. Yet again, you are a real winner. Wonderful. Moving on to the next award now. This is for the Nutrition Campaign of the Year. And this is the last award in the organization category. And guess what? This award goes to none other than Baxter India Private Limited. Baxter is a third generation olive oil based lipid emulsion available in India with high omega-9 and polyphenol content, which has the above mentioned benefits of avoiding metabolic complications, preventing cellular injury, promoting a favorable immune response, and preserving the lean body mass. What a wonderful achiever. Congratulations, Baxter India Private Limited. That really calls for celebration. So here we come to an end to our organization's awards. And I think let's have a big round of applause for all the winners, definitely, or all the companies who truly deserve it. Congratulations to you all. Moving on to a very exciting segment now, which is the individual category awards. And I'm sure everybody is glued again. So this is going to be a real close one. So the first award for Nutrition Champion of the Year. And we have 2 lovely winners for the same category in no chronological order. The first winner is Aparna Tandon Jain. As a new product development in charge, Aparna has worked upon 2 new products with protein and antioxidants so that the consumers can get benefited from nutrition supplements and can get desired amount of vitamins and minerals and can maintain immunity. About 5,000 plus clients. That's quite a number. And she has also written extensively. She's a blogger, like we all can see, and she's spreading immense amount of nutrition knowledge. Congratulations, Aparna. You deserve this one, definitely. And now we have the second contender who has won the Nutrition Champions of the Year. And I don't want to guess this one because we all know the kind of work that she's done during the pandemic. We have Miss Mehak Sethi. Mehak Sethi initiated to give free nutrition counseling to all under when she actively provided nutrition counseling to about 15 to 18 individuals on a daily basis. And if you look at her achievements, she has actually written a lot of articles in the nutrition knowledge segment. She has conducted online seminars for school kids. And she has also, what is most important is that she's done free nutrition counseling, which was in need of the hour. When the economy was hit, she went on to serve people for free. So that is a big, calls for a big round of applause and congratulations to you, Ms. Mehak Sethi. You truly deserve it. And now coming to the next set of award, which is for Innovation in Immunity and Diet module. And like I have the last update, which I have received from my team, all right, there we have 3 winners in this category. And this is, I'm going to move in no chronological order. First, we have The award for the innovation in immunity and diet module goes to Ms. Jaya Mohan. Wonderful. So Ms. Jaya Mohan, 800 clients across the country. She's helped patients of hypothyroid conceiving through her innovative diet. She's somebody who actually focuses a lot, I was told, on exercising and helping people build a daily routine. And not only that, she also believes that compassion and support are extremely important if people want to improve their immune systems. She has been working a lot on mental health, and I think that is the need of the hour. Congratulations, Jaya Mohan. You truly deserve this award. The second award, now you have the second individual in no chronological order who is entitled to the Innovation in Immunity and Diet Module Award is none other than Ms. Gauri Anand. All right, so we have Ms. Gauri Anand in here, who's an innovator in immunity and diet module. She has been sharing free diet plans across the pandemic phase. She also specializes in helping people with diabetes, approaching lifestyle approach, helping people with eating habits which went for a toss during the pandemic, and also serving the whole inch loss debate of people becoming obese while because sitting at home and not moving. She has quite a lot of credits, like we all can see. Congratulations, Ms. Karianan. You really are an achiever in your own domain. And now, moving on to the next winner for innovation in immunity and diet module. And that is, she is the last winner, the closing winner of our segment. And she's none other than, I hope I'm pronouncing this correctly, but it's a beautiful name, Sagulsam Regina. And please forgive me if I've not been able to announce your name correctly, but I think that is the biggest challenge. This is a very interesting story, ladies and gentlemen. On your screens, you know, she has counseled 50 plus patients on a daily basis, wearing PPE kits, and physically went to meet them, ensuring their health status. That really means a lot. She's a true Corona warrior. Encouraged and emphasized consumption of locally available natural food products in formulation of diet like amla, mosmi, green vegetables. She had the procure knowledge to actually help people psychologically also improve their health along with good nutrition. She is a true Corona warrior, and we'd like to salute her. Congratulations, Miss Redina. Wonderful. That's amazing. So those were the awards for the evening. And now, ladies and gentlemen, we need to give a big hand to all the lovely, lovely contestants today who are with us and all the lovely winners and champions. There is no doubt that the champions and the winners today have had a very skillful journey as well as a real adventurous journey through the pandemic. They are true Corona warriors. Congratulations to each one of you, and hearty best wishes from the organizers as well as the promoters and the partners of the event. I've had a very interesting time hosting this award show amidst such talented people, such senior people in health in the industry in India. And I thank you so much, Heal Foundation, Dr. Swadeep Srivastav, Mr. Shankar, thank you so much for having me today to have hosted this ceremony for everybody. Thank you all the lovely partners that you joined hands and putting up this amazing show, which is watched by so many, as we can see the numbers on YouTube and Facebook rising. I'd like to leave you with a closing note before I move to Dr. Srivastav. And that closing note, as a motivational speaker, I really feel that health and happiness, if they are your body, immunity and nutrition are your organs. So take care of your organs, heal yourself, and love yourself. Namaskar. Over to you, Dr. Srivastav.
Shagun, thank you, Shagun. Wonderful hosting, and you made it so lively. Though we are online on screen, but it was looking like we are sitting in a award ceremony in a five-star hotel.
Thank you, Dr. Srivastav. That's all your encouragement, and congratulations to Heal Foundation for doing such an excellent job through the pandemic. Honestly, and I've had a brilliant time working with you in the past also, and looking forward to many more in future.
Look forward to more. And so my first caveat is that, see, these awards in these tough COVID times are based on limited nominations, so it is not holistic or not doesn't cover the real aspect. There might be other people in the industry and in individually as well as organizations who would be doing a much better work. But those who nominated, out of those we were able to select, and these awards are more like a motivation, more like an encouragement to the people, to the organizations, to the brands, and to the individuals to keep doing what they're doing and keep doing it better. And these COVID tough times are for everyone. This will pass, but what we can do as organizers, as Heal Foundation and as organizers, we can keep putting up such platforms for motivation and encouragement. That's best what we can do, and that's what this award is for. Thank you for all the jury members. I'd like to have a closing remark from starting from Ms. Rekha Sharma to Sony, and then finally from our Dr. Pandav on this. Ma'am, please.
Good evening to all. First of all, heartiest congratulations to the Heal Foundation, Sudeep, to yourself, and to Dr. Pandav for taking this initiative of having our immunity champions. I think it's very, very important at this time that people are innovating. I heard few talks and they're talking about Ayurveda, talking about yoga and sleep and relaxation techniques, a good diet, immunity boosters. I also congratulate all the winners. I think they've done a great job and I wish them all the best. And we just hope that they will continue doing the same and will really, really help our community. And eventually, all these products that have been made should go to the common man, and everybody should have an advantage of using these and utilizing the expertise that has just been discussed. Thank you and congratulations to all the winners once again and to the whole team of Heal Foundation. Thank you.
Thank you, and thanks for your time and patience. Welcome. I welcome Sony back to India, back to her home, I believe, because last session we did with Sony, and that was on organ transplant. And then you had not reached your home, though you had reached India. I hope you're back to your home after a wonderful trip to Malaysia. And I remember the series of Women in Lockdown series which we did, and we need to continue to Women in Lockdown 2.0 with you and Shagun. So we did 2.0, now we need to move to 2.0. Your comments.
Thank you so much, Swadeep. Wonderful. This whole session has been so enlightening for me. I am a foodie at heart, and for me, it's always been a struggle to find the right balance between good food and tasty food. So I was reading somewhere that eating is a necessity, but eating intelligently is an art. And after hearing everybody speak today, I've realized it's not just an art, it's actually a science. And all the wonderful speakers in the entire session today have imparted so much knowledge to me personally, and I'm sure to each and every participant who has heard them speak today. My heartiest congratulations to all the winners. They are doing fantastic work. They're providing a yeoman service to society at large. And it's just amazing how even a small pebble can have such a wide ripple effect that if you're changing the eating habits of one person, you're actually creating an impact in the life of his or her entire family. So eating right is something which is ingrained in us. I have heard the speakers earlier in the day talking about how our scriptures talk about the importance of the right kind of food, the right season to eat what is good to build our immunity. And after hearing them, it's just more and more deeply ingrained in me that Indian food, a balanced Indian diet, is unbeatable. It is unmatched. It provides you everything that you need. All the different nutrients are there for you. And it's just a question of following it diligently and in a moderate manner. So once again, my heartiest congratulations to all the winners and all the best to Heal Foundation for more and more such fantastic initiatives in future.
Sony,
Thank you.
Tell a bit about your Eat, Drink and Be Merry group, which is very popular group on Facebook.
All right. So food being such an integral part of our lives, during the lockdown, group of my friends, we all got together and we formed a group on Facebook called Eat, Drink and Be Merry. And initially we were just sharing recipes. But as we got deeper into the pandemic, we were all suffering from something which I have called food anxiety. So what happens is that as homemakers, as housewives, the biggest fear I had personally, and I'm sure a lot of other homemakers also had, was what will I serve my family? How will I feed my family? Should there be a shortage? Should I not be able to get fresh vegetables, fresh foods? How will I manage? So during the lockdown, all of us got together and we shared with each other what we are cooking, how we are managing, what kind of ingredients are available, what kind of different things you can do with even very basic ingredients. The biggest fear I had was fresh sabzi nahi milegi, to what will I serve? Khana kaise khayenge? So then I set my mind at ease when I realized that I can use dal. Sprouted dal can take the place of fresh vegetables in case there is such a situation does arise. Thankfully it never did, but this group has been such a support pillar for all us members during the lockdown, and helped us not just in terms of giving us ideas of what to cook, but also giving us a daily goal, in the sense that we all would decide an ingredient and say the next day that we will all cook with the same ingredient and see what all different innovative things we can make. So just this thought that tomorrow morning I have to make this, I have a short term goal ahead, I can achieve it, and I'm having fun while doing it. That helped relieve so much of the stress and anxiety that the lockdown had created in my life, that I'm so grateful to all members of the group.
Thank you, Sonia, and congratulations for your husband becoming Major General.
Thank you so much.
Thank you, and from you and Shagun, I take the commitment of starting Women in Lockdown 2.0 after
absolutely.
Chavi has to work actively with you to make this live. And now coming on to Sir Dr. Pandav, just to tell a bit about Dr. Pandav, he is not only the champion of Eat Right movement he's so closely involved with, but he's also, other than being a public health, holistic public health expert, and worked in this field for 35-40 years, more than that, he's also a champion of nutrition. He's called as Iodine Man of India because he introduced iodization, salt, and that becomes one of the biggest and most successful micronutrient deficiency eradication program in our country, became a case study world over, and he's a part of the global forum of iodine deficiency disorder eradication. And Dr. Pandav is so deeply involved with so many nutrition programs, including the Poshan Abhiyan of Government of India, where he sits on the committee, prestigious committee as a member, and works closely with Niti Aayog on devising policies related to the right kind of balance of nutrition, the food security, nutrition security, part of the coalition of nutrition security organization, and a lot of sir. We were trying to put this in place, the nutrition summit in the form of India Immunity eSummit and awards. So your comments and your blessings to close this, sir.
Namaskar. First, I would like to express gratitude. Gratitude to my fellow physicians, nurses, support staff, drivers, security staff for taking care of us. Gratitude to them. They have taken a risk. They have taken a conscious decision to be in the well of death so that we can live peacefully and conduct seminars such as this. First of all, gratitude to them. Second, gratitude to our distinguished audience who have been so patient. I think we were overshot by about an hour. So gratitude for being there with us. The third gratitude is to our distinguished panel members, extraordinary brilliance, exemplary experience they brought to this particular seminar. Gratitude to them. Finally, I would like to say happy birthday to our Honorable Prime Minister Narendra Modi. Today he turns 70th. What a coincidence, Dr. Sadip Srivastava. This happened by not by design, but just by chance. Honorable Prime Minister,
in fact, we are also
Narendra Modi,
today because
sorry?
We are also celebrating, by chance only, we are celebrating his birthday today also in a big way through this summit.
That you can't ask for a better nutrition recipe. Honorable Prime Minister Shri Narendra Modi, I consider you as a public health practitioner, not of the century, but of the millennium. The series of programs you have introduced are incredible. National Health Mission to its completion, National Nutrition Mission,
Swachh Bharat, Beti Bachao, Beti Padhao, Ayushman Bharat. He has prepared. In fact, he created a context and environment to fight any disease, bacterial, viral, fungal, parasitical. COVID-19 तो बच्चा है इसके सामने. So, Honorable Prime Minister, most gratitude to you for giving this exemplary leadership. Two more things from my side. I believe in a triangle that moves the mountain. The triangle is formed by the leadership of Sri Narendra Modi, but we are miserably failing into the science part of the triangle. The triangle has three angles: statesmanship, society, and scientists. Statesmanship has been exemplary, but we are miserably failing in terms of the scientist part of it. Who are running the program? Who are advising the program? It is a classical case of fish, which is good in swimming, advising rabbits how to run. The real exemplary scientists who should give the advice to the government of India are epidemiologists, public health specialists, behavioral scientists, management experts. So my appeal, Honorable Prime Minister, please do take corrective action in time. These 150 days have been days of nightmare. So my humble request to you, sir, Honorable Prime Minister, of such an exemplary occasion, is please get the right people. Let the rabbits run the race and let the fish go back to their pond and start fishing. Thank you so much, everybody, for your patience, and let's move in the right direction. If you do not have the right advisors, the history will not forgive us for all time to come. And certainly, for me, this is going to be a great moment I would like to lead, because I don't want to be a part of that history which has made blunders and not timely corrections. Thank you very much.
Thank you, sir. Over to Dr. Thank you, sir. Thank you so much. Over to Dr. Ankit for the thank you note and the final video, if you can play in the end.
Thank you, everyone. Thank you for joining us for today. I'll take the opportunity to thank all our speakers, all the winners, and our jury, and Shagun for hosting such a wonderful award ceremony, and to all our audience who has been stayed with us till 7, although we are stretched over from 6:15 we are stretched to 7, but still everyone has been with us through all out the program. I will also like to thank our partners, ICCIDD, Coalition, Food and Nutrition Security, our media partner Express Healthcare, academic partner Maharishi Ayurveda, Lok Bharti. Special vote of thanks to Jamia Millia Islamia University. And with this, I will leave you with our 150 days of work, with the promise to bring you more such programs. I'll just play the
Myself, Dr. Kabir Srivastav. I am a public health expert. I represent the HEAL Foundation, a healthcare advocacy group in India. And today's objective is I wanted to introduce to you a very unique program called Heal Dai Samvad. You can even call it Healthy Samvad or Heal Dai Samvad, which is being introduced by us, brought to on our platform by HEAL Foundation in association with an international public health program, ICCIDD. संवाद के लिए मैं आप लोगों को धन्यवाद देता हूँ हिल फाउंडेशन की टीम में. The speakers that you brought are वो तारे आसमान से जमीन पे ले आए आप सारे सितारे थे. Excellent panel of speakers. Excellent. Best you can think of. My concluding message would be number one, that the entire world is your family, as our ancient scriptures have said. Vasudeva Kutumbakam. Why? Because this virus does not discriminate between any color, caste, creed, country, age, or gender. हम सब एक लोग हैं, एक कुटुंब है हमारा. So we have to face this pandemic with a human face, expressing sympathy, empathy, and compassion.
संकट काल में पेंडेमिक के इस काल में कि जब पूरी धरती पर भय, असुरक्षा और एक प्रकार का अवसाद है, ऐसे काल में आपने एक संवाद का अवसर दिया है. हमारे शास्त्र कहते हैं कि बाधे बाधे जायते तत्व बोध. जब कभी व्यथा हो, अवसाद हो, चिंता हो, अल्पता और विशेषकर कोई रोग हो या मानसिक क्लेश हो या किसी भी प्रकार के मनुष्य के सामने चुनौती हो, तो वो संवाद करें.
Sometimes it can be a relief also that you don't have to get up and wear your best clothes and be out and about. That can also be relaxing for the first couple of days where you can just be. But after some time, I do feel when such an extended lockdown happens, in order for you to feel a little boost to your own self-esteem, for you to do something in the day, there's nothing wrong in wearing clothes that you would go out in, putting on a little makeup, doing your hair.
foundation has been doing considerable work. It's about 10 years old now. And we have been organizing a lot of health writers workshop, and main focus is on training health writers to report accurately on health issues and current health issues, and not be carried away by sensationalizing things as many of previous do, especially after the onset.
I guess that's all for the day. We'll meet again. Good night, everybody.
Thank you so much. Thank you. Thank you so much.
Thank you.